topic of providing an update on the behavioral health.
Just 1 second. We're just trying to get updated here to go live on YouTube.
Oh, excuse me. I'll have to run through that whole introduction again, will I?
No, you can.
No, Madam Chair, we need to say we moved up item number 4 with Marnie and Nick, and we are back on YouTube in the work session. So we're ready to go.
Okay, good morning, Chair Harrington and Board. Marnie Kyle, Director of Health and Human Services. And we appreciate your time this morning. This is a follow-up conversation related to the workforce shortage that we are experiencing in behavioral health, both at our department as well as at the community level. So I will turn it over to the capable hands of Nick O'Coon, our Behavioral Health Division Manager.
Morning, Chair. Good morning, Commissioners. And there it is. I was just going to ask about the presentation, and it is about to pop up like magic. Wonderful. My name is Nick O'Coon, as Marnie mentioned, and I'm the Behavioral Health Division Manager. And today's presentation is going to be a briefing on our current behavioral health workforce situation and the shortage that we're experiencing both in Washington County and also elsewhere in the state. Next slide, please. For today's presentation, I'm going to do a high-level overview of the situation, and then I'm going to take some time looking at some factors that are contributing to the workforce challenges that we're currently seeing. I'm going to be going over some data that we have on the hiring and workforce challenges that we've gotten from our Association of Community Mental Health Providers, and also from the Oregon Council of Behavioral Health, which is a council that represents approximately 40 behavioral health agencies and organizations across the state of Oregon. So it's really a state level view of some of the data that we're seeing. We're going to be talking about some local implications of this current workforce shortage, and also spending some time on a legislative next step that has been enacted in the recent session to address the situation. I want to take some time too to just talk about some next steps that we are currently doing and proposing, and just hear from the board related to any feedback about those next steps. A lot of this presentation is really as a briefing and an FYI for everybody, recognizing that we anticipate that the current situation that we're in is not going to be resolved quickly, that it could potentially get worse, and we want to make sure that everybody is aware of what we are currently doing and what is happening in the community in case we hear from constituents about it. Next slide, please. So as an overview, the community behavioral health workforce is currently experiencing a historic workforce shortage. And this is having local, statewide, and national implications on the ability to ensure access to behavioral health supports. We're going to be spending some time looking at some local data, but it's really recognizing that this is something that's being experienced nationwide, where we have fewer clinicians entering the field, we have more vacancies, we have people leaving the field, and we don't have the same level of workforce and support that we did even 18 months ago. Next slide, please. To continue the overview, what we're hearing from our providers right now is that they are experiencing increased costs to operate business, particularly around delivering services and supports during the pandemic. We've heard a lot from the increased costs related to additional infrastructure that needs to be purchased to support both in-person and virtual supports of clients. And that's where some of the efforts that are being taken to retain staff through increased salaries are actually not able to do it as much, because at the same time that we have workforce leaving, we're actually seeing more costs being incurred by our provider organizations. We're really hearing more about increased employee turnover within the behavioral health field. We've heard a lot about turnover being something that our agencies are dealing with year in and year out. We're hearing both that this is that there's a higher level of this turnover at this time, but also that we're not having folks reapplying for the vacancies that are happening. And we'll get into some more of the data around how long it's taking to hire and some of the folks that are actually leaving the field. We're hearing about a decreased access to services for our community members. We have current behavioral health providers that are reporting that they're not able to take new intakes until up to November at this point because of their staffing and their real focus on just maintaining the ability to support current clients. The access is decreasing for folks that are presenting with behavioral health symptoms and that are needing care now. And we'll talk about this a little bit more later, but we're actually seeing as well that there's our services at risk of being closed altogether because we don't have the current staffing required to support our population and also to maintain critical staffing levels required for either fidelity or OAR standards for operating certain levels of support. Next slide, please. So what is causing this shortage? The shortage started, we started seeing this in advance of the beginning of the pandemic, but we've really seen it escalate during the last 12 to 8 months while our agencies have been dealing with the current, with COVID-19 and its impacts on the behavioral health system. As I mentioned earlier, we've had pretty significant increased costs incurred by our providers, which are really leading to kind of system level stress throughout our provider organizations. And we're seeing a really significant increase in workforce stress as well. I just received an email actually the other day from one of our providers who is looking for ways to have a workforce training about how our providers can just support our providers. There is stress in supporting our community members. There is stress related to our providers just supporting themselves and their families. There is stress related to our providers supporting their peers that are also going through stressful situations related to the pandemic. And we're really seeing this compound with some pretty pervasive workplace stress within the behavioral health field that we're hearing more and more about and is leading to some of the shortage that we're seeing. We're also seeing an increased severity of behavioral health symptoms in the community members that we're serving. We've had a high level of behavioral health need throughout the county and throughout the region historically, and that's being even increased during the months during the pandemic, where we're seeing higher levels of anxiety, higher levels of depression for folks that are coming in, and that folks that are requiring support are actually requiring higher levels of support than they previously did, even clients that have been engaged with services for a while because of the increased stress that they're experiencing. Next slide, please. Other factors outside of COVID-19 that are leading to this shortage is really that historically the behavioral health field has had non-competitive salaries relative to other fields. And in advance of this presentation, I did some research related to what the average mental health clinician in Oregon makes against what the average registered nurse in the state of Oregon makes. And the average mental health clinician makes approximately mid-50s for salary as they are in their career. And the average nurse in Oregon makes somewhere in the mid-90s at the midpoint of their career. And this is, I was looking at similar education backgrounds and fields during my initial research, but in the months and weeks leading up to this presentation, I've actually heard more and more about folks leaving the field for other positions that don't require a bachelor's or a master's altogether. And whereas we have folks starting around $50,000 with a master's degree, that folks are actually leaving to get jobs at Amazon or other places that are starting at $20 an hour and having pretty significant signing bonuses as well. So we're really seeing the behavioral health field having a difficult time competing with other salaries that have less stress and that folks are choosing to leave altogether. We're seeing a high level of workforce trauma and burnout related to the severity of the clients that we're seeing that are having our clinicians choose to either leave the field altogether or to look for a less stressful place to work within the behavioral health field. And we're also seeing high levels of administrative burden that are leading to folks leave. We're hearing more and more from our our agencies that employees are giving feedback at the exit interview that they're not able to support clients because they're burdened with paperwork and reports and all of the other administrative burdens and mandates that are associated with the behavioral health field that aren't necessarily in the same at the same level within other fields, similar to what happens in primary care and other health related industries. We're also seeing behavioral health system level barriers that are leading to more severe symptoms and fewer resources to support clients. What we're hearing is that our clinicians are ultimately feeling helpless because they don't have the resources available in the community to support the clients with the level of support and care that they need. The example I like to give around this is that we've historically had pretty good access at the state hospital for our clients that are civilly committed because they are being found to be a danger to themselves or others and are determined eligible for long-term care at the state hospital. And over the last year, we've actually seen absolutely no access to the state hospital for those clients because all of the admissions to the state hospital have been for our aid and assist population, which are for individuals who have committed a crime and are unable to aid and assist in their own defense. What we're seeing then is a compounding in the system where we have folks that are there's less resources in the hospitals because we aren't able to get folks to the state hospitals, which also leads to less resources in room in our emergency departments, less resources available in our residential system, and less resources available to our intensive community-based providers. And so we have this compounding effect where we're not able to support our clients because we don't have the services, supports, and resources available to be able to provide the level of care and support that our clients need. This is leading to the burnout. This is leading to folks feeling helpless, and they're ultimately choosing to either leave their positions serving our highest needs clients, or they're leaving the field altogether. Sorry, there's some downers involved in this presentation, so I should have given that disclaimer up front. Next slide, please. So here's some of the data that we're hearing from both the Oregon Council of Behavioral Health and also from the Association of Community Mental Health Providers related to some of the current hiring and retention challenges that they're facing. The Oregon Council of Behavioral Health, which I mentioned previously, is the council representing 40 agencies across our state. They're reporting a 10 to 30% workforce reduction across the behavioral health system. And so at certain points of the behavioral health system, certain levels of care, they're saying still having about 90% capacity, whereas others are down to a maximum of 70% capacity because of the workforce shortage. I put this presentation together based on June data, which was really current at the beginning of July. And I'm hearing that this is getting even worse today, that particularly in our residential levels of care that we're seeing pretty significant staffing shortages. And I think that if we took a poll of the data from these providers today, that we would see these numbers being even higher, unfortunately. Statewide community behavioral health programs have lost between 40 and 45% of crisis staff in the past year. We'll talk a little bit more about what this is looking like on the ground here locally in a little bit, but historically we've had about a 20% turnover rate amongst our crisis providers from our community mental health programs, and we're seeing that increase to 40 to 45%, and we're actually seeing an increased difficulty hiring for those vacancies where there's just no clinicians in the pool that are applying for these jobs, and so the vacancies are open longer or they're just not being filled altogether. And that's the final bullet here, is that we have multiple positions in the field that we're hearing about statewide that are routinely posted and just never filled, or they are posting vacancies again as soon as they fill one vacancy, they have another resignation that's coming in. Next slide, please. This is a really nice chart that I got from the Oregon Council of Behavioral Health that they got from some data they pulled from all of their organizations related to what the average time to hire based on current vacancies are. What we see in this chart is that about 10% of current vacancies are hired within the 30 to 45 day period, which we would see as typical as far as time to fill a vacancy historically. And that 30% of these vacancies are taking upwards of 70 to 90 days to fill, and 20% of these vacancies are taking 180 days or more to fill. A full 18% are perpetual openings that are either never filled, or as I've mentioned previously, we have resignations coming in as soon as a vacancy is filled. So they're just leaving those positions open indefinitely. We have no data from 22% of the providers, but this is a pretty good representation across the board of these agencies that are operating both in our local region, but also throughout the state, of how difficult it is to hire folks right now and how long it's taking to refill positions once they're vacated. Next slide, please. And this next chart is looking at some exit interview data that was compiled by the Oregon Council of Behavioral Health, really looking at where folks are going after they're leaving their positions from the community behavioral health field. And what we're seeing is that about 50% of these employees are leaving for another behavioral health career, but from a higher paying competitor. And we've heard a lot from our behavioral health providers that folks are leaving community behavioral health to work in hospitals, to work in managed care with our coordinated care organizations, to work in schools, but are not serving our folks in the community, or working with our crisis teams, where some of the most significant vacancies are happening. We're seeing about 25% of the vacancies are folks that are leaving the field altogether. They're leaving to get another job in another field, as I mentioned previously, that either has a more competitive salary for comparable education, or that it is just a less stressful job because of the level of stress and trauma that the employees are currently reporting within the behavioral health field. And then we have a full 25% that are leaving and just being unemployed. They're just leaving altogether. There's a degree of optimism that when we are at the back end of the pandemic, when kids are in school full-time again, that some of these folks might be re-entering this workforce. But even with that optimism, we have a full 25% that have just decided to leave this field altogether at this point. And so this is really showing what we're dealing with and where some folks are going when they're choosing to leave their positions. Next slide, please. So this slide shows some of the really fantastic work that our providers are currently doing to hire and retain staff. We're hearing a lot of wonderful things about signing bonuses for new hires, some really fantastic retention bonuses that are being put in place agency-wide by some of our providers. And we're also hearing about some agency-wide salary increases that have been put in place to retain staff. There's been a huge focus on how do we retain what our current staff is, recognizing that we don't have the workforce to fill the vacancies clearly that we once did. And so agencies are going to tremendous measures to be able to retain their current staff and to stop this bleed. We're hearing a lot about the local CCOs supporting some of this work as well, and providing some emergency funds to providers in order to support these retention efforts, because everybody in the system recognizes that this is reaching a crisis, and there's all hands on deck right now really trying to support these retention efforts in our agencies. We've heard a lot about COVID incentive pay for providers who are seeing people in person during the pandemic, and a lot of effort to compensate and recognize that work with some incentive pay. And also hearing a lot about resources that have been dedicated for staff recognition and for appreciation. Everybody's trying to pour in appreciation for the wonderful work that our clinicians are doing, in hopes that they continue to do this work and see the joy in supporting their community in the way that they have been. Next slide, please. With these retention efforts, this next slide really shows the budget impacts that they have been having, and what we're hearing from providers about the long-term sustainability of some of the efforts that have happened. In a poll this is another, some more data that came from the Oregon Council of Behavioral Health, and out of their 40-ish organizations, they are reporting that 92% of them have reported needing to increase wages across the board in order to retain their current workforce. And that full 92% don't necessarily have an ability to balance their budget after these wage increases. We've had a lot of influx of one-time funds from different sources to support these retention bonuses, to increase pay. but the rates and other contracts that sustain the budgets long term, we don't have there's not the resources in the system to do that. And so providers are expressing some anxiety related to how are they going to support these impacts long term. Next slide, please. So here's where I want to talk about some of the local implications of this workforce shortage, and to talk about, in particular, about our Washington County crisis team and the approximate current 15 vacancies that they have on that team. Currently, right now, they have 13 vacancies for qualified mental health professionals, or QMHPs, which are our master's level clinicians. And we're really looking at potentially curtailed walk-in hours continuing because of this workforce shortage. We had curtailed the hours related to the pandemic in hopes to limit folks walking in at the height of the pandemic, and we're really looking at that potentially needing to go on for an extended period of time because of the staffing shortages that they've had. They're talking right now about some messaging around prioritizing referrals for same day or next day appointments to minimize wait times for some of the walk-ins, and also potentially not having walk-in hours certain days of the week because of the level of staffing. We're doing everything we can to support them and keep the level of support there, but the staffing shortage is pretty profound. We're also hearing that there is a potential delay in the expansion of the mental health response team that we're also excited about. There's currently 3 vacancies specifically for this expansion that they have posted, and they're doing everything they can to hire them. And there's a lot of other positions as well. And so we're seeing a potential delayed timeline related to that expansion because of this current situation. We're hearing more and more about increased wait times to access services locally. As I mentioned earlier, we do have agencies that are saying that they aren't able to see clients for multiple months out. Some have been saying out until November, and all of our agencies are saying that the wait times have increased because of the workforce shortage. And that we have community mental health or behavioral health programs, and providers saying that they need to close certain programs due to staffing. We had one youth and adolescent outpatient addictions program that needed to close because of staffing levels. And we have one residential substance use program in our community that has been closed for an extended period of time because they weren't able to maintain the staffing levels. So their hope is to get that program back online, but it has taken longer than they anticipated because of these staffing shortages. Next slide, please. This next slide really details some positive news that we have, where there was a really significant influx of resources related to this issue in the current legislative session, where House Bill 2949 included a $70 million investment targeted at workforce development. And so what this bill aims to do is it establishes a statewide task force to study the issue, to really look at the core reasons of the issue and to look at solutions. It focuses on increasing diverse representation in the behavioral health workforce, ensuring that our workforce is reflecting the communities that we are serving, loan forgiveness, scholarships, and retention bonuses. We're still learning about how this is going to be operationalized, where those funds are going to go, and we'll talk a little bit more about what we're hoping to advocate for in the next steps in just a bit. Next slide, please. So some of the next steps that we're looking at, and when I say we, I'm working very closely with our government relations manager, Paige Spence, on this, and also AOCMHP. This is definitely going to be a team effort going forward. And some of the steps that we are proposing is to continue to collaborate with our providers to identify ways to hire and retain staff. There are multiple work groups that are happening specifically targeting this workforce issue, and our goal is to continue to be at every single table that we can to be able to add to and influence this conversation as much as we possibly can as well. We want to look at contributing resources to support provider efforts. We know that our providers' budgets are going up, and we want to come to the table with them with resources that we have available to support this, and are looking to partner and support them in any way that we can. We want to engage in state level advocacy to address the issue. We really want to look at where contracts can be amended to address some of the administrative burdens that I talked about previously, and also look at advocacy both with OHA and local legislators as well around how significant this is and what some potential solutions could be to curb what we're seeing. We want to advocate to the state that some of the dollars that are allocated in House Bill 2949 that I just mentioned flow through the community mental health programs and providers so that we can work on making sure that they're getting into the hands of the agencies that are hardest hit, that are serving our highest needs community members, so that we can ensure that they're being spent in the best ways possible. And we also want to meet with local legislators to discuss additional bills to address the situation. First and foremost, we're looking at contract and more immediate administrative solutions, but long-term, we want to look at potentially some bills in the short session that could also help support this, recognizing that this was a great first step, but there's going to be some potential work to continue to be done. And finally, both myself, our division, and the government relations page, our manager, we want to support the board as much as possible in aligning messaging across the Tri-County area. We know that this is an issue that is being briefed with the boards in Clackamas and Multnomah County as well, and we want to be available as resources of information about what's happening on the ground to support each one of you if you're having conversations with other commissioners about this issue as it continues to evolve. Yeah. So that's the conclusion of our proposed next steps. Next slide, I think, is just bringing us home. And so I know that I left some time for questions, if anybody, in conversation, if anybody has it. I know that we also got moved to an earlier time slot, so we might not have the same time, but I would love to just be available to answer any questions that folks have, and just to have a conversation about what's going on if needed. Thank you.
Thank you, Nick. Thank you, Marnie. We do have time for commissioner questions and comments, so thank you. Commissioners. Go ahead, Commissioner Willie.
Yeah, thanks for that presentation. And unfortunately, it's also pretty reflective of many other industries that are having difficulty either retaining or even hiring people. In this particular expertise in the nursing education, is behavioral health a specialization that's a kind of a subset of the nursing education process? And the reason why I'm asking that is because I am aware of Pacific's University's Hillsborough campus and their nursing program. So is behavioral health just a part of the process, or is it a specialization? And is there any way we could tap into that maybe a little early to encourage those folks to come to work for us?
Well, they also have a whole psychiatric training as well at Pacific.
And a lot of the behavioral health field that we're talking about today is a separate discipline within the healthcare field. They're both a part of the healthcare industry. There's absolutely behavioral health specialties within the nursing field, particularly around the psychiatric nurse practitioners that we have supporting a lot of the medication management within our agencies. And what we're hearing is that there's a desire regionally that we're hearing more and more about to push as far upstream as possible, and to talk to nursing schools, to talk to social work schools, to talk to even high schools and students who are receiving their bachelor's right now about the behavioral health field, and also just to really authentically characterize what the field looks like, so that folks, students choose to enter, but also know what to expect. So when they do enter, they stay. And so I love the idea of partnering with nursing schools, and I love the idea of partnering with other education academic facilities as well, because this is something that we're going to have to get really creative about long term, I think.
Commissioner Willie, I would add that all nursing educational, behavioral health is a requirement. It's basically, at the very least, it's a semester of classes. But I think that the real challenge is the lack of pay parity, because as Nick said, nurses come out of nursing school, sometimes even with an associate degree, and they're making $80,000-$90,000 a year, as compared to the qualified mental health providers who have to have a master's degree, and they're coming out of with a master's degree and being offered, $50,000 a year. So it would be really hard to attract nurses into that sort of a pay range. So we have to deal with the parity issue around livable wages in the behavioral health field.
So is the nursing position a much more higher skilled? That's why the compensation is higher, or maybe there was just more behavioral health folks available. So the mass generates more competition for position and drives prices, compensation down. I mean, is there anything truthful about that?
I guess I mean, I'm a nurse, so what I would say is it's comparable but different skills. But I think that nurses about 30 years ago went through this sort of a shortage, and we're starting to see that again. And so those salaries were dealt with about 20 years ago, and the behavioral health providers are, I would say, comparable skills, comparable education, but it's also just reflects the value of our society, and the value that's placed on physical health versus mental health, is, in my opinion, also contributing to this pay inequity between behavioral health and nursing. In my opinion, it should be a pretty equivalent pay, but there's no way that our community behavioral health community could afford that right now.
There's a pretty significant difference in the percentage of funds that come from an insurer to support behavioral health versus physical health. And while we know that all of members of a coordinated care organization or an insurance plan are going to their PCP, hopefully on a regular basis, that isn't necessarily the same level of penetration in the behavioral health field. It's a really disproportionate level of funding that go to the two systems. And so the ability and the dollars to support a behavioral health system just haven't historically been there. And what we've seen is just years and decades of a pretty significant difference in pay amongst the different fields between behavioral health and the different disciplines within the physical health specialties.
Thank you for that.
Very hard problem. Other commissioner questions? Commissioner Rogers.
I'll just make a couple of comments. Nick, this isn't unique, as Commissioner Willie was pointing out. Every industry is facing exactly the same issue. I just got back last night on an airplane, and I was in another state in which every business had posted signs, help wanted. And businesses have not yet adapted, and you are a business, you're just a mental health business, to what the realities are. And you have some issues that are nationwide that need to be attended to. One is that everyone keeps saying, let's raise salaries a whole bunch. If we just raise that and pay bonuses, everything's going to be better. Well, if one industry gets a raise, another industry wants it, and another industry, and another. And what's going to eventually happen is superinflation. You haven't seen it yet, but my prediction is you're going to see a lot of inflation. The feds are trying to taper it down, but there's no way you can print money excuse me, and spend it in the way we're all spending it and not have inflation. Secondly, bonuses are having a reverse benefit. What's happening, and I can only speak in industries that I talk with, is that when you start saying, I'm signing up somebody with a bonus, the person who's there and what we're reading, or I'm reading in various, is about half your employee force is looking all the time. They're going to say, well, I didn't get a bonus and I'm sitting here doing the work, so maybe I'm going to walk down the road. That's an issue. The third issue for people like you and other industries that I'm in, people don't want to come into work anymore in terms of physical presence. They want to work from home. And so if they'll find a career that'll provide them an opportunity from work from home, and that's happening, you take a look at the backgrounds on where everybody's from, and they're even on this meeting, they're locations other than an office. And so it's very difficult if you're providers. And one of the disadvantages you have, and I have it in my private life, is that you have people who are highly skilled, smart people, that can do other things. And so frankly, they'll look for other opportunities to apply those skills. So you got national problems, you got inflationary problems, you got a lot of issues, and you're not unique. So what would I do if I were in your position, honestly? And you're not going to do it, but I would tell you what I would do anyway, is I'd turn your model upside down. I'd quit looking at saying, I've got to have the smartest and the best in the room. Look at what corporate America is doing by industrialization and saying, gee, do every task that I have, does it have to be done by a master's degree clinician? Are there not ways to layer it so that you have folks who can do different things? I see Tom Carr sitting there, and if he's been in the private sector, he knows, that you got a whole bunch of different folks in a law firm other than all lawyers. I mean, half of their firms, and accounting firms are getting that way too, that half of their folks in their employ are not CPAs, attorneys, doctors' offices. Look at how many people they have doing different things. So if you were looking at something different, and I would challenge you to do that, how would you design your business so that you could use people who may not be those master's degrees, so that your pool expands? Because your pool isn't going to increase a whole bunch. I can tell you that. Other issues that we see locally are travel. I see it in my own firm. People are saying, gee, there's not a real bunch of travel options. And doesn't look like there's a lot of investment in transportation systems. I'd rather do my work from home. Figure a way for me to do it if I'm going to remain employed by you. And so everyone's figuring that. I don't know how you do it in your business, whether you can go remote in terms of consultations, in terms of delivery of service. But I don't think, and again, I'll stop with my preaching, but I don't think the answer is just to say, we're going to throw more money, and that I'm sure that's going to work, because what's going to happen, we're all throwing more money, and it just increases, and it's not going to change unless you have a delivery model that might be different. And I know you can't do it today, but I certainly challenge you to say, what if I were starting over again, would everybody in my shop have to have a master's degree to do everything that I do? Or could I have some really smart people? Nurses are no different. They have folk, they say that, they do all that work, but they're not doing all of the changing of beds in hospitals and all of the numbers of other things. They've developed different classes of responsibilities. Take a look at that. And then you and I can cry together, because we're facing the same problem. Everybody wants those smart people. So we got to look at ways of doing business different. So I'll just stop with that.
Commissioner Fye, do you have any comments or questions?
Thank you, Chair Harrington. Thank you, Marnie and Nick. This is a really great presentation, and it's disturbing, especially now that we're in COVID and a lot of people are facing mental health impacts of that, this pandemic. And, I'm available however I can help in terms of the advocacy you're trying to do with other electeds to get some money. And I agree with Commissioner Rogers. I think I don't know what the process is in terms of hiring, but I do know some other professions, they do consider where, the education components to meet it with the number of experience to meet that So I don't know if it's the same process for here in Washington County, but I know from previous experience, if you need a 4-year degree or 6-year degree, you need to have a 10-year experience of that field kind of thing. So I don't know if that's the same situation for here, but I think that's an interesting element to look into to see, could we alleviate some of that education requirement and meet that demand for experience, using that experience. And, listening in, one of the things I remembered was the whole movement of the community health workers and redesigning the workforce in the hospital and adding that element into it. Have we really, looked into the whole behavioral health workforce and see how we can reconfigure to alleviate some of the stresses? Because I think that movement, if my memory serves me correctly, it was really it helped the hospital and the workforce in the hospital to have a community health worker infused into that workforce to deal some of the what Commissioner Rogers was saying, that doctors or nurses don't necessarily have to do. A community health worker can help. Is there an opportunity to remodel the behavioral health workforce and use that? So I'm here to help, and I'm on this journey with you.
Go
Thank
ahead,
you.
Marty.
And
So- Oh, I just wanted to reassure Commissioner Rogers and Commissioner Fye that there are different entry levels into the behavioral health workforce. And we are using peers and community health workers and paraprofessionals. We've been having conversations even with Emily Henke about, is there a way to help move some of those like case contact tracers and case investigators into the behavioral health workforce? Is there a role for them? And we certainly, nationally and here utilize telemedicine, telehealth as an opportunity that works for a lot of the behavioral health workforce. So, but it also complicates some of the issue because none of that is reimbursable by Medicaid or not. I shouldn't say none of it, but much of it is not reimbursed. And so those are all great ideas, and they're all great ideas that we are promoting and working on with our partners across all the way up to the federal government. So, and I interrupted Nick. He's probably more knowledgeable than me, but.
I was going to say a lot of the same things that you were just saying, Marnie, just really expressing appreciation for your comments on this, Commissioner Fye and Commissioner Rogers, and to just let folks know that some of the advocacy that we intend to do with the state is looking at the administrative requirements that require certain levels of education and degree to provide certain services, and how can we rethink this a different way? How can we deliver these services with other professionals with tons of experience, both professionally and personally, that could provide really wonderful supports to our community. And so we want to look at this in a different way. We have requirements that are in place both at the state and federal level, as Marnie is saying, that are they're administratively in our way right now. And so we want to really engage in the advocacy necessary to highlight the issue and look at seeing if there's some creative solutions that we can engage with different parties and to solve them.
I can thank you for mentioning that. I completely forgot the workforce for the contact tracers. Yeah, they really make an ideal behavioral health workers, because I know when I was doing the contact tracing management piece of it in the midst of the pandemic, I know a lot of the contact tracers took calls, and a lot of the people, mental health was a big piece, and them themselves learning to navigate their own journey and then help somebody be safe and also protect the whole community from COVID was a big challenge that I think with Washington County Public Health staff and the contact tracing was able to navigate that. So that's a really good workforce. I forgot to mention that. Thank you, Marnie.
So I'll make it a full sweep of thanks and appreciation for all of the creativity for your bringing this topic forward and problem solving it. What a great team we have here in Washington County. This really is a quality of life issue for people in our community. It's also a quality of community issue. People die due to the fact that they can't get the kind of care that they need. Other people get hurt and people experience trauma. All very undesirable experiences for individuals and community at large. I know from personal experience that here in Washington County, we've really had a crisis of care for our higher aged community members prior to our current decade. We have a shortage of psychiatrists for our eldest community members. Unfortunately, I also know through family experience with bipolar disorder, schizophrenia, depression, and alcoholism that these difficulties that people and families here in our county, but across our nation are real. Certainly one of the reasons why I've not propagated my gene pool. We can take individual action, but it's also going to take community action. These are real difficulties that are not only our community members, but our workers are experiencing a very high degree of suffering in our community that affects us all. We also see it in our houseless community members as well, as our senior community members. So I join my colleagues in really appreciating the level of commitment that you, our subject matter experts, are displaying in your service, your creativity to helping us figure out how to support that movement to redesign the workforce, to advocate for the reimbursement of these more effective, hopefully cost-effective solutions, and will continue to support the proposed steps that you've outlined here. It really boils down to, yes, we understand the challenges that you've outlined, the very real problems, and bring us anything and everything you can to move forward with these next steps. I think I've summarized where your board members are at. And I know from conversations with Commissioner Treese that she would join the four of us in that as well. So short of being able to print money ourselves and to redesign the system right here, count us in for wanting to do what is needed to better the condition here in Washington County. Any other questions that you have for us, Ms. Kyle and Mr. Akun?
No, thank you so much for your time today.
Go team, go.
Thank you.
All righty, it is 10 minutes before the hour. We do have one more topic to round out this morning's work session. So there she is, Eva Labonte on the Civil Service Commission member appointments. Commissioners, I suggest we push on through even if it eats into our lunch hour. Ms. Labonte, welcome.
Thank you, Chair Harrington and other commissioners on the call. Great to see you. I am really excited about bringing forward our slate of candidates for the Civil Service Commission. So the Civil Service Commission offers a third-party review of our interpretation and implementation of the civil service rules for those positions that fall under civil service. So when either a candidate for a position or an employee in those civil service positions feel like an adverse reaction or adverse action has been taken in either a hiring process, promotional process, disciplinary action, those types of things, they can make an appeal to the Civil Service Commission. And then the commission hears their concerns and then makes a decision on the correct, if there needs to be corrective action by the county to follow the civil service rules. So that's what this commission does. They have 5 members, at least one from each of the districts, and they cannot be a member of the governing body of the county or an employee of Clean Water Services. We had a great applicant pool. However, we missed a candidate from District 3. So I have 4 to bring forward. All the positions are currently up for renewal. So I have 4 to present to you for consideration. The first one is Jean Kawamoto. She is a resident of District 1, and she is also part of the county's Property Tax Appeals Board. She works in human resources at Portland General Electric, and she has been there for over 20 years. She's worked as a generalist and also has worked in recruitment, which is a great feature for a commissioner because they understand those hiring processes and how they work. She's also worked for the city of Portland and has a basic understanding of civil service. And Ms. Kawamoto identifies herself as an Asian woman. Our second candidate is Mahesh Udada. Mr. Udada is from District 2, and he works as an industrial engineer. He's worked in both Intel and IBM in that capacity. He clearly has a passion for community service. He's served on a number of boards and commissions, including the Community Action Team and the Health Equity Alliance. And he also serves as a current member of the Washington County Parks and Recreation Committee. He has earned a Bachelor of Science in Industrial Engineering and an MBA in Operational Management and is a PMP certified civic leader. Mr. Mahesh identifies as an Asian male who was raised in India. Our third candidate that we're presenting is Justin Heath. Mr. Heath is a resident of District 1 and has been a county resident for several years. He is an attorney. He's earned his JD from Lewis and Clark School and a BA in political science from Portland State University. He has been a member of the Oregon Bar since 2019 and part of the Labor and Employee Relations Association since 2018. He currently works representing labor unions across the state, working with school districts that have classified employees. He's also worked for Kaiser Permanente and also in employment law in Creighton and Rose in Portland. I think he's a great addition to the commission. He brings the labor side of the view, which is, I think, also very helpful to bring a balanced approach to the commission.
Commissioner Willie has a quick question for you.
Oh, sure.
You're on mute, Jerry.
Your information is a little conflicting. The detail says that he's a resident of District 3, but your graph says he's a resident of District 1. So which one is he?
That was a typo. He is a resident of District 1. Thank you.
Okay. Thank you.
Yeah. Mr. Heath is fluent in Spanish. He does identify as a white male and as a parent of mixed race children. Justin Locke is our fourth person that we're bringing for your consideration. Mr. Locke is the only person that is currently on the Civil Service Commission. The other 3 are new members. He has served on the commission and was serving as the chair of the commission when his term expired. He does work for Nike, and he runs Nike's Diversity, Equity, and Inclusion program in the Enterprise Architecture and Platforms program. He was raised in a home where English was not the first language, and Mr. Locke speaks both Russian and Spanish. And he does identify as a white male. So with these 4 candidates that we're bringing for your consideration, does, I think, in a great way improve our commission to be 50% people of color and a female on the commission. We still have that open spot that we will be actively looking to fill in from District 3. So what questions do you have for me?
Commissioners, any questions or comments? Commissioner Rogers?
Eva, I must have misheard that. The CWS isn't part of the civil service program, but I thought you said something about CWS.
Yeah, our civil service rules state that you cannot be an employee of Clean Water Services and serve on the Civil Service Commission for Washington.
That was the point. Okay, thank you.
Commissioner Fire, Commissioner Willie, any other questions or comments? Nope. Okay. I would add, thank you, Ms. Labonte, for making sure I understand that this is like the Planning Commission. This is the only other committee of our boards and commissions where district residency is important.
It is.
Or applies for the appointment. So I appreciate that. I do just have a question, not for this particular appointment, but as applicant members cite being on other boards and commissions, as our departments go through the applicant review and interview process, do they also look into the history of attendance for boards and commission members?
It's a great question. We did not do that for this recruitment. We just went with their application, and we talked to them. We interviewed everybody. We had a panel of 4 people who interviewed them. They all showed a lot of passion for this work, and we meet quarterly unless there is a demand for a hearing. So their service is not monthly, it's only quarterly, and we did confirm with them that their time availability. But that's a great question. No, we didn't ask that question.
I have no particular worries about this for this or any other. I'm just wondering systemically if that is done. That's all.
Yeah.
So just a question of curiosity for moving forward. So I have no further questions or comments to add. So with what you're hearing and not hearing today, I believe the board is ready to move forward with these appointments. And I thank you and your team for all of the follow through on this.
Thank you very much. We'll be bringing it for your consideration on the consent agenda on September 7th.
Terrific. Thank you very much.
Thank you, everyone.
Right. Commissioners, so we are under the wire for completing this morning's session of the work session. So we have just one topic, another mighty one or weighty one, if I might add, at 1 o'clock. So unless there's anything further from the board or from our leaders, go ahead, Jerry.
I just say, like, Tanya, please let the staff know that we appreciate, we fast tracked them into the 11 o'clock slot. It helps us a lot. So thank you, and tell them thank you. We really appreciate their participation and helping us out at that.
Thank you, Commissioner Willie, and I know the board shares in your sentiment because I see the heads nodding, and I've already shared that appreciation with the team. I think we just need to prepare ourselves. Sometimes it's not going to be able to happen, but we will do our best to accommodate the board schedule.
Terrific. All righty. Well, see you all back on the same link, same Zoom link at 1 p.m. Thank you. So Kevin or Ms. Niola, if you can hear me, if you could advance Ken Gibson, Mayor of King City, Marie Bowman-Davis, and Sherwood City Council President Tim Rosen, who is here in place of Mayor Keith Mays, Jason Snyder, Mayor of Tigard. Thank you, Kevin. You're doing great. Frank Bubanek.
Thank you, Madam Chair. We're just having a little trouble with Mayor Gibson. He's just not seemed to be moved over for us.
Okay. Mayor Gibson, I don't know if you want to leave the meeting and try reconnecting. Christina Bauman is our health officer from our regional health system, if you could advance her. Mayor Beatty has joined as an attendee.
Okay, can you hear me?
Yes, welcome.
Yeah, I clicked on attendee rather than panelist. That's why you couldn't hear me or see me.
Okay,
Okay. How are you, Catherine?
well, I'm hanging in there.
Okay, glad to hear that.
I'm so appreciative for the mayors of Washington County because we're all in this together.
Yes, we are. We are a team.
Hey, Nafisa. I enjoyed our chat the other day.
Oh, hi, Tim. How are you? Good to see you.
I'm doing well. Hope you're doing well.
Yeah. Hanging
Chair,
in there. Just
Chair Harrington and Clerk Moss, may I also ask that Kimberly Rep be added as a panelist because she may also be able to answer questions that the mayors and commissioners have today.
Yes, thank you.
Thank you.
It just wasn't attending. I wasn't attending to the attendees list properly. Oh, there she is, Dr. Kimberly Rep.
And Mayor
Oh.
Fitzgerald's in the attendees list as well.
Yep, Julie Fitzgerald. Thank you.
So, Madam Chair, once we hit 1 o'clock, we are back live on YouTube, and it'll be back to you.
Okay. Well, good afternoon, everyone. Welcome back to the Board of Commissioners work session for Tuesday, August 17th. I've taken a slightly unprecedented step today. We are in the last topic for our work session on a COVID-19 update and discussion. Given the information that has been shared with me from state officials, I've taken the unprecedented step to invite all of the mayors from the various Washington County cities to join this section of our work session so that they have the full benefit of hearing from our great public health team, and so that they can ask questions as well, because we are all served by the same Washington County health system, and we're all in this together. And then after we've gone through Q&A, we will return to just Board of Commissioners discussion for any potential next steps. So I've never had to manage a meeting of this many folks, and I will admit I'm not the best at finding all the hand raises. So I beg your patience in advance, but I know that you'll help me through. So I'm going to turn it over to Marnie Kyle. Many of you or all of you know Marnie as our Director of Health and Human Services, and she has, over her many years of service here in Washington County, and continues to assemble a great team on our behalf. So we'll turn it over to Marnie for setup and the latest and greatest information, because it has evolved even from the presentation that staff developed and put in the packet yesterday afternoon. So please hold your questions till the end. I'll call on commissioners first and then run through all the mayors. Thank you.
Thank you, Chair Harrington. Good afternoon, Chair Harrington, board, and all of our mayors from around the county. We really appreciate your time today. We do have a really serious, rather alarming topic to bring to you today. And as Chair Harrington said, even since yesterday when we completed this presentation, there has been updates and changes and new data, new recommendations. And so we're going to do our best to cover that for you today. One of the things that I want to say is a thank you to Chair Harrington, because one of the important things to note is that Chair Harrington is on calls with the governor's office, where OHSU and the governor's office is sharing data that is about a week ahead of the data that public health is receiving. And so we have been talking to OHA about how difficult that is, because we feel like we're oftentimes behind and scrambling. But in Washington County, that's not the case, because Chair Harrington immediately shares the data with us so that we can get ahead of it. And we're able to share it with our regional partners in Multnomah and Clackamas County. So a huge thank you to Chair Harrington for being willing to share that data with us and with the rest of the board and the community, because it's really helpful to get that. The other thing is that, as I mentioned, a lot has changed even since we put this presentation together. So I want to introduce Marie, because this is her debut in Washington County, and I'm really proud of the talent that we're able to attract here. So Marie is a doctor of philosophy in public health with a focus on health behavior. She also holds a master's degree in public health and a bachelor's degree in health sciences with an emphasis on community health education. She has a master's certificate in health education from the National Commission of Health Education. She brings to us 25 years of community academic research and government supervision and experience in public health. And most recently, Marie was working for Washington County since October as a research and evaluation analyst that served in the position of the COVID-19 epidemiology data and quality assurance supervisor. So Marie has a lot of experience and expertise, and we are very fortunate to have her. Also, and Marie will be going through most of this presentation this afternoon, but we also have invited Dr. Christina Bauman, who is our health officer, and Dr. Kimberly Repp, who is our lead epidemiologist for public health, who's also been with us for, I think, 8 or 9 years now. So 10 years, wow, okay. So it is a very talented group that's going to be available to go through this presentation and answer your questions. And of course, I'll be here as well to assist as needed. So with that, I will turn it over to Marie.
Thank you. Good afternoon, commissioners. Good afternoon, mayors. My name is Marie, and I look forward to sharing some COVID-19 data updates with you today. If we could advance to the next slide. Great. So some of the topics we'll briefly cover are transmission, projections, wastewater, some data about our children, some strong recommendations, and resources. Next slide. So I wanted to start with our Centers for Disease Control and Prevention. They have been tracking our community transmission of COVID-19. As we see here on the far left column, there are two indicators. The top row is the case rate for the past 7 days, and the bottom row is our test positivity for the past 7 days. If the two indicators suggest a different level of transmission, as highlighted here in the green box, the CDC recommends that the higher level is selected. And so moving to the right, we'll see the 4 columns. Our blue is the lowest transmission level and red is our highest transmission level. Next slide. So as mentioned by Marnie, the transmission levels have changed since this presentation was submitted. So at the time of this presentation, we are looking at the CDC metrics, which are also available on the Oregon Health Authority website and dashboard. So this was for the week of August 1st. Our case rate for Oregon was 177 per 100,000, which it would indicate a community transmission of high. So in the red zone, the test positivity was 9.5%, which would be substantial. Again, following CDC guidelines, we would be in the red, in high. As of last night, the CDC metrics were updated and the OHA dashboard was updated. So for the week of August 8th, Oregon is now at 309 per 100,000. So we are still in high, we are just higher. Also to note, at the time of the older data, we were at average hospitalizations of around 25 per day. As we know, it's higher than that now. Next slide. When looking at Washington County, for the week of August 8th, our case rate was 86 per 100,000. Which indicated substantial. As the data were updated last night for the week of August 8th, we are now at 129 per 100,000. So we have moved into red. We are at substantial now here in Washington County for our case rate. Our test positivity rate is still around moderate. Last week it was 6.4. This week it is 7%. Next slide, please. So about once a month, we are able to obtain projections from the Oregon Health Authority. The latest report we received was dated July 29th. And so these projections are for the time period of August 4th through 17th, which will be today. And so at the time of this report, OHA was expecting an exponential increase in our diagnosed cases, both in case rate and hospitalizations, which we have been monitoring, I'm sure, and we are seeing now. Next slide, please. At the time, they were also modeling our transmission rates. And so here, the black line shows the observed case rates, and the red line showed the diagnosed projected. And so we are seeing increase in community transmission projected, as well as we have been experiencing those. Next slide. This is the last slide from that report. This is also looking at hospitalizations, where the black dots show the observed daily counts and the red line shows the hospitalization projections, assuming the transmission rate stayed the same as it did the week ending July 14th. And as we see here in the red, the dramatic increases were predicted, and we have observed those in the past few weeks.
So Marie, I'm going to just add here, this slide, these last couple of slides are some of the differences that we're seeing between what Chair Harrington has received from OHSU and what we received about a week ago from OHA. And a couple things. I think one, it's important to understand that the data that that Chair Harrington has shared, the slides from OHSU, that is statewide data. And Marie is going to go into some of that and some local, but more focusing more on our local hospital system in Region 1. And it's important to understand the statewide hospitalization is in dire, as OHSU is describing it, collapse. But our region, in Region 1, our metro area hospitals aren't quite there, although they are stretched paper thin. And our strong recommendations at the end today and the discussion that you all will have is really to prevent us from getting to that dire state that we see in other parts of the hospital system within Oregon. So sorry to interrupt you, Marie, but I just wanted to kind of point out these differences we go through.
Thank you. I appreciate that. So, all right, so this slide here was made available to us by Clean Water Services. They've been collecting data since April of 2020. I apologize, these images are not as clear as we'd like them to be. They are the best we could obtain for you. So they have been collecting weekly sewage samples from 4 water treatment facilities. They've been tracking COVID-19 in our community wastewater. So the blue line here are the virus concentrations, and the black line are the case counts. And so Clean Water Services has shared with us their wastewater reports have been used as an indicator of cases during major surges. They have also reported to us that as of July 26th at the 4 facilities, they are showing the Delta variant is between 80 and 100% of the viral load. Oh, sorry, next slide. Thank you. So earlier this month, as I'm sure everyone is aware, the CDC recommended universal masking for K through 12 and around the, and we have the masking here in our schools in Oregon. And around the same time, a report of the American Academy of Pediatrics and Children's Hospital was released. So I just wanted to highlight some of those data. So on the left side of the slide, the report noted that over 4 million children have been infected throughout the course of the pandemic nationwide. So they have represented about 14% of all cases. And in their most recent 2-week data period, so that was the end of July, so July 29th through August 5th, they are seeing increases in case counts as well as proportion of cases. And so the right side of the screen are just the last 3 weeks of data that were made available. And these are the case counts by week. So we see visibly the increasing trend. Next slide. Thank you. And so looking at our local data, so we have the regional dashboard that we're able to look at Washington County case counts cumulatively. And it is important to note that children in the American Academy of Pediatrics report varied in age range across the states. However, 0 to 19 was part of the age ranges. And here we have our 0 to 19 population in Washington County, and cumulatively, they represent nearly 1/5 of our COVID cases. So as we are aware, the governor and the state has taken some actions to provide some indoor masking guidelines, as well as universal masking guidelines for our schools. And since we are out of substantial and in the high community transmission, it is important for us to revisit our recommendations. And these recommendations are across multiple strategies, and they are needed to help us slow the spread of COVID in our community. And so Two of the strategies that we'll review here are limiting our exposures and reducing the spread. And so effective measures, as we have seen in the past to limit exposures, include carrying and wearing masks. So again, for our ability to follow our indoor mask policy, but also if you're out and about and you're in a situation where you would feel that you cannot stay distanced, you have the opportunity to put on a mask. So we need to try and increase our distance again, keep that distance of 6 feet. We also should be avoiding unmasked crowds and large gatherings. And other effective measures to reduce the spread include following our quarantine and isolation guidelines, monitoring symptoms for COVID-19, getting tested regardless of vaccination status, and notifying close contacts of exposures as well as our test results. Our public health system is really burdened, and we can help out our community by staying in contact with our close contacts and sharing information. Additional recommendations for recovery is to continue to isolate and minimize our contacts. These have been effective measures in the past. Seeking help for severe symptoms, although our health system is experiencing burden, it is still important to seek help for severe symptoms. And then acquire about resources available. Washington County has a telephone number that the community members can call to see what resources are available. We also still want to encourage vaccination. We know that it reduces risks of severe illness, hospitalization, and death. They're free and effective and available to persons 12 and older. And I think here we'd like to encourage the continued updates of information, continue to seek information about safety, eligibility, and availability. As mentioned earlier, information about COVID keeps changing, and OHA just updated their guidelines yesterday to allow a third dose of Pfizer or Moderna for immunocompromised persons in our community. And so this is just another example of why it is important to keep current on information about COVID-19 community transmission and vaccination in our community. We do keep our website updated, so feel free to share these resources throughout the community. We have vaccine availability, including mobile vaccines, pharmacies, and events. And lastly, we have our website updated with important information, updated fact sheets, videos, websites, emails if people want to send in questions, as well as phone numbers where they can call and ask questions. And that is the end of the presentation for today. Thank you.
So Marie, thank you for the update and the new data. I want to end by sharing that the board, as acting as Board of Health, does have the authority to consider more restrictive community-wide measures. So the public health recommendations today that we provided, these are our recommendations that we're asking citizens to voluntarily do. But we look forward to your conversation today. And if the board is interested in considering other measures, then public health is certainly here and available to help you think about how those could be implemented and how we could support the board's wishes. I just wanted to share that. And I think that we are happy now. I think we're happy to answer any questions that you have.
I'll start if you don't mind. Can you speak to the difference between the level of hospital utilization that you're aware of here in Washington County versus that is represented to me and other county commissioners.
Sure, I think Dr. Bauman is probably got the most up-to-date information. She was on a health systems call yesterday, I believe.
Yeah, thank you, Chair Harrington. So the situation is constantly changing. As we know, hospitals have different resources that they can tap into, different strategies that they can use to make more beds available and to shift population or shift the hospital patients to different levels of care. So absolutely across the state, the situation is dire. We've certainly heard about the alarming situation down in Southern Oregon. In our region, our hospitals are stretched. They are doing everything that they can to make beds available at the level of care that patients are needing, and they're collaborating among each other. They have been working with partners at different levels of care to offset some of the burden, whether that's to direct patients to seek care at urgent cares, to extend hours, to work with emergency departments and social services to try and find the best location for care. So they are actively managing the situation. Their bed situation is stretched. They have absolutely made clear that an ICU bed is not the same as an ICU bed, and meaning that some ICUs are better staffed for higher levels of specialty care, whether that's someone that needs pulmonary support with ECMO or with dialysis. And those are certainly resources that are in very limited supply, and every day staffing situations change. So I hope that answers your question. The situation is serious, not as dire in other regions, and it changes every day. So we certainly are keeping close tabs on what is going on and how we can help across our public health and health systems.
Okay, so before I call on Mayor Gibson, Snyder, and then Beatty, Commissioner Pam Treese is with us, but she is attending by telephone and doesn't have the ability to be transferred up from the attendee list or flag. So Commissioner Treese, do you have any questions at this time?
Thank you, Chair. I do have a question, and it's in regard to the efficacy of different types of masks. I've been seeing information about the types of masks that are indicated to be more protective than others. Can you comment on that, please?
Oh, Christina, do you want to take that, or I can take it either way?
Yeah, no, I can take a first pass, and if there's something else you'd like to follow up with, please. So fortunately, compared to earlier in the pandemic, PPE supplies are improved. So the a spectrum of effectiveness of masks for personal protection, the respirators N95 masks, especially if they're fit tested, are the most effective and used in our healthcare systems. Next would be medical and surgical masks that offer some water resistance, also offer a lot of personal protection. When it comes to face coverings, some of the parameters are that they're well-fitting without gaps, that they have multiple layers. Cotton multi-layer masks are effective for personal protection. And so that's sort of the range of personal protection. When it comes to public protection, that's another important aspect of the masks, in that mask face coverings, in that they contain droplets. And so again, multiple layers add protection from the spread of droplets from a person to another individual, and their first contain the spread of the virus.
Thank you, Dr. Bauman. Ken Gibson, you're up. And after you will be Mayor Snyder, Mayor Beatty, City Council President Rosen, and then Mayor Truex.
Okay, thank you. Great presentation. Appreciate everything that you guys are doing. I think you mentioned that boosters are possible for, or even recommended for those who have Pfizer and Moderna. What about the Johnson & Johnson one shot? Has there been any conversation about boosters for those folks, including myself, who had the Johnson & Johnson one shot?
Marie or Christina? Or Kim, who has the latest information? We've been batting this around today, emails.
So right now, the guidance that's come out of CDC is specifically about a third dose for people who are moderately or severely immunocompromised. And that is primarily with the mRNA vaccines. And that's because there is some evidence that a third dose can result in an antibody response in some individuals with moderate or severe immunocompromise. There is not that level of data for the Johnson & Johnson vaccine. And so that's why Johnson & Johnson has not been included in that recommendation.
Okay, thank you.
Mayor Snyder.
Thank you. As we're having a conversation about what may or may not be appropriate for, additional measures to protect the community and protect individuals, I think it's really important for the entire group of people that are making decisions, many of whom are not healthcare folks or epidemiologists, to understand the mathematics of this and and I'm really speaking about the transmissibility. I'm curious to know if one or more of the experts that's on the line today could speak about what is different now about the significance of the Delta variant in the indications that it's in the wastewater. I think my understanding is that there's a difference in transmissibility, but if you could quantify that and then quantify what that means mathematically in infection rates compared to what we've seen over the last 18 months, I think that's important for this group to understand, because it will drive a lot of my decision-making and thinking.
Dr. Rep, would you like to speak to the Delta transmissibility?
Sure. Thank you for the question, Mayor Snyder. It is really important that we understand what's different about this Delta variant. So now the majority, so between 80 and 95% of cases that are being tested and sequenced are showing up to be the Delta variant. It is the dominant strain in Oregon now. It wasn't a month ago. It wasn't 2 months ago. It wasn't 3 months ago. And now it has completely taken over as the dominant strain. Why? Well, for this particular evolution of the virus, it is 8 times more transmissible than the others, which means previously, hypothetically speaking, if I was infected with COVID, before, I might be able to transmit it to 1 or 2 people on average. With Delta, I'm transmitting it to 8. So that is astronomically. So think about that. Imagine you're going to the grocery store and we have transmissibility of 1 or 2. Okay. Now imagine that if it's 8, and then imagine that person doing 8 more and that person doing 8 more. I mean, that's why we're seeing this curve just go up like we have never seen before. It's because this virus is much, much more transmissible, and it is not as covered by the vaccines as some of the other variants. Does that answer your question, Mayor Snyder?
Yeah, thank you. I mean, I guess I think to be maximally effective, I think it'd be good to tie those those findings to why you all are recommending what you're recommending and what you think the results will be. I don't know if you can do that, but that, to me, that's kind of key to this discussion.
Well, as we have, I mean, that response involves a lot more people than me, certainly. But what we have learned is if we go back and look at the epidemic curve that we've already been through, and you label where the interventions were, like, so we implied, we did no outdoor dining, or we entered, all these different stages that we did, you can actually watch the curves drop and by how much. So different interventions lead to different results. So for example, if you want to reduce hospitalizations specifically, there's something associated with that. If you want to reduce spread, it's something else. So they each kind of play on a different part, but overall, if we want to reduce loss of life, we certainly want to go back to at least social distancing. And as Dr. Bauman said, great mask wearing. And, if this continues, perhaps, our elected officials, you all will have to make some difficult decisions.
Well, and what I would add is that the most effective tool that we have in preventing hospitalization and death is vaccination. We need everyone to get vaccinated. Yes, there are breakthrough cases, but those are not the people that are really ending up in the hospital or dying from this disease. And so I think vaccination is our number one tool and most effective tool, and everything that each one of us on this call can do to promote vaccination, the safety and the efficacy. It's free, it's simple, it's widely available. That's the most important tool and message. The second thing that we know is highly effective is if everyone were wearing a mask. Christina, Dr. Bauman shared with us, the most effective mask, but any face covering or mask is better than no face covering or mask. So those are two really effective, important strategies that we have to get everyone to comply with. And that's the starting place.
Next, we'll move to Mayor Beatty.
Thank you, Chair. And just whoever's managing the meeting, Mayor Lanahan is in the attendees that should be upgraded to panelists for the conversation.
Yes, and only mayors have been invited to this meeting, just so everyone in the attendee list is clear.
I just want to thank you, Chair Harrington, for inviting mayors into this conversation. I think it's important as we look at the next step that we're moving in one direction together. I have a couple of thoughts. Our council really looks towards the county commission when we're making decisions about public health. So to our county commissioners, to our chair, you are a force multiplier in decision making. A lot of our councils do not have access to the information that you guys have access to. And so I encourage you to be brave in the next part of this conversation that the mayors will not be at, because our councils will be making decisions based off of your recommendation. Not to put any more pressure on you, but you are the level of government entrusted with public health. And we want to be a partner with you, and we want to echo the messages that you have coming out. I think it's the right step by inviting us to the table, but know that when we go back to our councils, they're even more removed from this information than we are. And so think about that in your decision making today. So I just want to implore you to be brave. 3 things that I see as the mayor that are challenging for the next couple of weeks for us is enforcement. And what does that look like? My sister is a server in a restaurant that is bullied and screamed at every single day, that is literally putting her life on the line to serve people food. And she needs to do it to pay her bills. So it's not like she has an option. So how are we going to empower business owners to join us in this conversation with masking? We've had that same conversation for 19 months. So I don't think there is like the right next answer, but can we take a meaningful first step in enforcement of this policy? Because as a mom with a kid starting school, our kids and our businesses should be at the top of our mind right now. How are we going to keep young people in school? How are we going to keep businesses in the economy opening? The second is testing. My kiddo was sick last week. It took me a whole day to find her a COVID test. It was negative, thank God. I couldn't find myself a COVID test anywhere in this county in 5 days. So in the recommendations from our public health expert, it's recommending vaccines and testing. So what do we need to do as a community? What do we need to ask the governor's office for? How do we, and it's likely much worse than your slides are saying, because people can't access the testing that they need to show it's there. And my third point is boosters. We know that they're recommended right now for immunocompromised individuals, but we also have data showing that BIPOC community members are being infected at a much higher rate. So what are we going to do to make sure those communities get access to boosters first? And how can we partner? So thanks for having us today. Those are my 3 thoughts.
Thank you, Mayor Beatty. Next, we'll move to City Council President Tim Rosen from Sherwood, who's here for Mayor Keith Mays.
Thank you very much. And it's Tim Rosner, by the way.
Sorry,
that's okay.
trying to manage the list. Sorry,
it's a
Tim.
very, very common mistake. You're running a good crowd on that one, so no worries. Anyways, thank you for the presentation, and I want to echo some of the other thoughts. I really appreciate all the hard work the county's putting into this and pulling this group together for this important conversation. I guess my thoughts on this, I spent some time looking into the data, and for anyone that knows me, I'm a data-driven person, and I've been following this pretty closely. But I don't pretend to be an epidemiologist or an expert on these matters either. But at a very high level, Washington County is doing better than some of the other counties around the state. It really doesn't matter though, because this is a regional issue, or this is a statewide issue. I was just looking at our hospitalization rates for the county, and I know those tend to grow. The data will come in to fill out these most recent weeks, but we're not running anywhere near as high as we were at the peak of the surge that we saw over the holidays, which just tells me that the other parts of the states are driving this at a much higher rate than we're driving it. And the reason I bring all that up is it is a statewide issue. And I would encourage the commissioners, when they talk about this, is about what kind of message do we want to send to the state, about dealing with this at that level. We can tell our community all day long, you need to do this, you need to do this, you need to stop doing this, you need to stop these bad behaviors. But it's not just us. We're being influenced by everyone around us in Southern Oregon and Eastern Oregon. So I would highly encourage them to think about that we need to message the state that the state needs to look at this as well, and what kind of protective measures do we need to put in place to bend the curve. And the last thing I just want to mention, just from a data point of view, I follow hospitalizations and deaths really closely. I don't follow the case rates as closely, because those are the two numbers that we're trying to solve for. And I just think we really need to be focused on how do we bend the curve on that, because case rates don't necessarily tell you what's going on at that level. So anyways, those are my thoughts. I encourage the commission to really put some pressure on the state, because I don't feel like we can do it all by ourselves. So
thank you. Mayor Truax, you're next. Then we'll have Mayor Callaway and Mayor Bubenik.
Thank you very much, Chair Harrington, and thank you for the presentation. Thank you also for the invitation. I guess my concern is with the slide that talks about children and COVID-19 local, the fact that we have the number of kids that we have, number of students. 19% of the COVID cases are school-age children or preschool-age children, cradle to age 19. And I guess the people that aren't here today, and it's not their fault that they're not here, but we have school boards and school superintendents that need to adhere to the message also. Governor Brown, in a story that just hit Oregon Live about, maybe an hour ago, is admonishing those school officials who seem to think that all of this is, frankly, to use a street term, bullshit, and it's not. We are putting our kids' lives at risk when we do some of the stupid things we do, and I would hope that, to echo Council President Rosner, that we would urge the state to come down a little bit heavier on those school districts that seem to think that would be practicing independence on the backs of their students' lives and teachers' lives. And I, as a former teacher, I take a little bit of offense at that. I appreciate a great deal that you are going to be making some decisions here that are going to be tough. I, for one, will back them as far as I can, and I think right now we need to mask up. This is somebody who is a huge sports fan, and I realize that high school athletics is just around the corner. People are looking to meet on Friday night to follow the Oblate Spheroid maybe we need to re-examine that because that's less than a month away. And I think today was the first day of practice. Yesterday was the first day of practice for fall sports. So there is a lot going on and a lot of decisions have to be made. I don't envy you, but I will help where I can. And I would like to share this information with my city manager and council. I believe, Tanya, you may have already been talking to our city managers about this. And so I want to double down on it. Again, Chair Harrington, thank you very much for inviting us.
So, and just to let you know, I did talk with school superintendents yesterday between 4 and 5. I'll speak to that after we go through this round of questions from the mayors. I'll just go ahead and contribute my thoughts. I'm not going to kick you mayors off from the visual here. That would waste time. I would just ask that at that time we turn to board discussion. That's all. Mayor Callaway.
Thank you, Chair, and thank you for including us in this work session and in the discussion. And I suppose a lot of my comments have already been covered. I will tell you that the transmissibility is sobering. You know, when I hear that it's not 1 to 2, and it's not even an exponential increase, you know, to 4, it is it's a tripling, if you will. And so, again, that is a real sobering information. And, you know, to really, I guess, tag along to Mayor Beatty's comments about school as well as Mayor Truax's, you know, that's my main concern. You know, the kids we know have been impacted, you know, by their removal from in-person learning for 2 years. And so as you have your discussion, I just ask you to prioritize, you know, their health and safety and success, you know, during this pandemic. And I appreciate the, you know, the work that you all do, because I know you're in a tough situation as you look to make decisions that we as city leaders will lean into and that we will carry forward. So thank you for accepting the burden of your responsibility that you bear right now.
Thank you, Mayor Callaway. Mayor Bubenik.
Good afternoon, Chair and Commissioners. Real quick, I'm going to grab the baton from Mayor Callaway. I was in a meeting yesterday with TTSD, several mayors, and Congresswoman Bonamici. Dr. Susan Reike-Smith, the director of the TTSD, said her number one fear that's keeping her awake at night is the wee kids, you know, the elementary school kids who don't have vaccines. That is her thing that's keeping her tossing and turning coming September on what to do with those kids and keeping them safe. So as other mayors have said, I encourage you to think about that those kids who cannot be vaccinated yet and might not be able to October, we have to think about. And secondly, as a city that is in 2 counties and a county that to be mentioned who does not take this as seriously as Washington County, I've got to deal with residents in 2 different counties. I would ask, as Council President Rosner asked, rather just, I'm hyper focused on just the 3 county region. We all transverse these 3 counties, and I would look to cooperation from Multnomah County and Clackamas County on this. I could see Washington County taking the lead, but I ask you to reach out to the other county chairs. I know you're gonna have a difficult time with one of them, but at the least to get this 3 county region in sync like we were before, if you want to make the next big step and increase some of the enforcement mechanisms and getting people to cooperate on vaccination and masking. Thank you.
Thank you. Mayor Fitzgerald.
Thank you, Chair and Commissioners. And I'm glad I'm following Mayor Bubenik because I'm also in 2 counties, much smaller part of Washington County. Thank you so much for inviting me. And that would explain my gratitude regarding the size of our city that is in Washington County. It's pretty small. And one thing that I just appreciate all of this, echo what everybody said. I'm also going to think about sharing a message of support to help bring people on. Maybe we can say support businesses, support schools, support our state by wearing a mask, by getting vaccinated. Maybe we can bring some of that rhetoric around the other way. Thank you.
City Council President Rosener, would you mind if I called on Mayor Shirato first since he hasn't had a chance yet? Go ahead, Mayor Shirato.
Thank you, Chairwoman. I appreciate the invitation, as the other mayors have enunciated here this afternoon. This crisis certainly requires all hands on deck, and we appreciate this information that you're sharing. And that's the reason I'm making my comment. I'm not trying to repeat anything that was already said. One of the things I did hear today is that the Delta variant is 8 times more transmissible. And that's the first time I've heard that. I'm sure that obviously that information is out there because you've had it and now it's being shared with us. And I want to ask if the county can do anything to broadcast that information, that we can make sure that that's communicated as best we can down into our communities. I've tried to follow this crisis for the year plus that we've been involved with it. And as I said, this is the first time I've heard the severity of the Delta variant, outside of the fact that it is highly transmissible. So rather than having just the city of Durham say, well, you know, this is 8 times more transmissible, I think that validating with some higher authority or more expertise authority than just the individual cities would be beneficial in us trying to communicate with our communities just exactly how dangerous this environment is. And to further illustrate that, I had a brother-in-law who has been vaccinated, who was admitted last night with COVID. Normally he would go in Beaverton to St. Vincent. They couldn't find any place for him except at one of the Kaiser facilities. So having had the vaccine, Tim is still spending at least tonight, and we don't know for how long, readmitted with the Delta variant. So my request again, please help us get the authoritative information out to our communities, how dreadful this disease really is. Thank you.
Thank you. City Council President Rosener.
Thanks, Chair, for letting me have a second bite at the apple here. I just want to add, I just want to emphasize, I think it's really important we send a strong message to the state and ask the governor's office to do more on this. There's so much mixed messages around this. At one point, we said if hospitalizations went over to 300, we were going to lock everything down again. They're way over 300 now, and the state is basically saying wear a mask. So I think it's again, this is a statewide issue. We can do some stuff as a region, but when it gets down to the core of this and our hospital capacities, it's not like only our citizens are going to hospitals in our region. They're coming in from all over the state, if I'm reading this right. So we need a statewide effort here, and this needs to come from the governor's office.
And if I might, I don't want to just call out mayors individually, but for some reason I don't see Mayor Linehan. And so I just wanted to ask Mayor Linehan if you had any questions or comments you wanted to add.
Thank you very much, Chair. I really appreciate the invitation today and all of the information that's been shared. My questions have been asked. I'm very concerned and have had very moving and meaningful dialogues with families, with children, and they're petrified. They're absolutely petrified for their children, as I am too. I have a 5-year-old granddaughter going into school for the very first time in September. So I don't know if you can hear it in my voice, but I am very petrified and very concerned for our children. So I just would like to see also some more. I know Mayor Beatty asked about the testing sites. You know, I have been kind of searching for that as well online, trying to find a place for testing sites. I think as we move into the
the fall, and also with, just the flu season coming around the corner. People are very concerned and they do want to get tested, not just for COVID, but for other things. And when you get a sniffle, I have to tell you, there are so many people that get like these, oh my gosh, I had a sniffle, I want to get a test, so it's already forefront in their mind. But finding testing sites, it's been a challenge. So thank you. That's all I want to share.
Thank you, Mayor Linehan. And I want to recognize today in our attendee list that we have Senator Chuck Riley, State Reps Courtney Neron, State Rep Dacia Graber, and State Rep Janine Solman with us today, and as well as a staff member from Senator Lieber's staff. Mayor Snyder, did you have something more?
Just very briefly, as you all are deliberating, I'm curious to know also why or whether it might be appropriate, as I'm thinking about how to disrupt something that's transmitting at 4 or 5 times the rate or 8 times the rate as something else. That's frightening math to me. And I've had a bunch of epidemiology and biostats classes. So I'm speaking from, I've seen this before in the math. I want to know whether the commission or we should be advocating for the state to have, particularly with schools opening in 2 to 3 weeks or even less, whether we should be advocating for a very short shelter in place or some sort of action that would totally disrupt the transmission in a much bigger way with the hopes of having a bigger impact. I know that's probably not a popular thing to say, but sometimes we have to say the right thing even when it's not popular.
Well, I'm about to say something very unpopular in my comments. So I'll make some comments and then turn it over to my board colleagues. So yesterday I did have the opportunity to meet with school superintendents. Yes, they are, of course, worried about the transmission rates, and they are doing everything they can to prepare. So I asked them about different things the board might consider. They feel very comfortable at this stage of the game about having full masking in the schools by students and school employees. They're interested in hearing about the county's thoughts about requiring vaccines. Governor Brown, if you all don't know this already, Governor Brown is requiring that state employees get vaccinated by October 18th or within, now I've lost the specifics, like a couple of weeks of FDA approval of the vaccinations. As I understand from Marnie Kyle, that date of October 18th is a hopeful date for FDA approval of the Pfizer and Moderna vaccines, and we're leaning into the hopefulness of that. So our county administrative and legal teams are looking into what that might mean for us, and will be informed about that in future weeks. The superintendents did ask that if we have any aspirations to introduce restrictions, to please think about just restricting attendance to those who were vaccinated, so that the events can still happen. But if anyone comes to watch events, whether it's, track meets, volleyball games indoors, football games, that they can still happen. But then, of course, it puts the pressure on the employees who are checking on those vaccinations. So just last Tuesday, I made an appeal to my 4 colleagues to consider requiring masks. As a result of hearing an affirmation of that, I called a special meeting for Friday, And then, as we all know, Governor Brown stepped in with the state mask mandate. And so I summarily canceled that meeting. We do have the opportunity, should we so choose, to put enforcement behind the mask requirements. Now, of course, we're not interested in actually policing people's wearing of masks, but would having a fine induce more wearing of masks? Maybe. So here's where I'm not going to be popular. I know, I've heard it loud and clear, like it or not, that our regional health hospital system is the backup for other counties. In the August 6th Governor Brown meeting with county chairs and judges, OHA Director Pat Allen cited that 20% of the Jackson and Josephine hospital admissions for COVID were 20% of those were transferred to metro region hospitals. That was then. This is now, August 17th. We heard just on Monday morning, very strong appeals, particularly as summarized by Joe Sluka, the CEO of the St. Charles Medical System, who had convened with his peers from the Southern region, Central region, and Eastern region, that Oregon hospitals have collapsed. And I'm not doing justice to that. He had the quotes point by point. And talking about how our nurses and doctors are experiencing this. Now, Chair Kafori and I each had questions about the OHSU model information that was reviewed with us in those slides. I've shared those slides with my colleagues as well as with all the mayors, and of course with Ms. Angie and Marnie Kyle. And I also, during the break between our executive session this morning and our work session, had the opportunity to talk to Dr. Peter Graven, as he describes himself, a public health economist, about his forecast. And I have some pretty grim messages from that, because you've seen the slides 7 and 8, that show a peak, and the case rate is just going even more rapidly. He said as of today, they have 15,000 cases in one day. And I clearly now understand that we cannot stop this peak. But what we can do is reduce deaths, and reduce deaths of COVID patients that are not able to get the care they deserve, as well as other hospital patients or people that need to get into the hospitals to get the care they deserve. Now, he shared that this spread is even faster than they forecasted. That's to the efficiency of the Delta variant. He said unvaccinated people are hanging out with one another. So the R0 is higher, right? That's the level of 8. And they're showing up at hospitals at a more regular rate. And these are young people. So he feels pretty strongly that we know that masking works at reducing the rate. But I don't know what's going to motivate more unmasked people to wear masks. But he was very clear with me that evidence shows that outdoor only dining works, that it is the quickest way, and a way that has worked every time we've instituted it with all of our prior surges, that it works, we've done it, and it's reduced the number of cases within 2 weeks. Now, we've got a peak. We're not going to be able to hold off a surge. It's here, and it's bad. The evidence supports outdoor dining. It's too late to help stave off a surge. We're in a surge. But he said if we put such a measure in place for 4 weeks, it will buy time for hospitals to catch up. Now, this is where our public health team, you have not heard them ring the alarm bell today like I am. And I am not a healthcare professional, but I hear the strain. Okay, I hear and respect Dr. Bauman and Dr. Rep and Dr. Marie Bowman Davis and our own Marnie Kyle. I respect all of them. But it's about saving lives. The situation may only be serious in Washington County hospitals, but it's dire elsewhere. Chair Kafori and I have asked really serious questions about what will affect change, meaningful change. And the only policy consideration is restricting outdoor dining and doing what public health recommends. People, wear your mask. Stop associating and hanging out with unvaccinated people, please. And please get vaccinated. So I sit here today thinking differently than I did just days ago that we should enforce a mask mandate. But what I do want us to do is strive to reduce the pressures on all of our healthcare workers and hospitals. As far as I know, policy-wise, the only thing we can do to help that is to restrict dining to outdoor only for the next 4 weeks. Pure and simple. This board only meets on Tuesdays or by special meeting. So I'm going to calm myself down. I've spent plenty of tears on this topic since August 6th. And ask my colleagues, what can we do to save lives, protect our children, and preserve our economic recovery? Commissioner Treese, are you still with us on the phone?
Yes, I am.
Do you have any questions or comments? Sorry, I'm picking on you first because you're on the phone while I can see your other 3 colleagues.
I appreciate you calling on me. Thank you very much. And I've learned a great deal today in relationship to the severity of what we're facing. I've learned a great deal in relationship to the criticality of the hospital availability. And while I would prefer not to restrict restaurants just to outdoor dining, I don't think we have any choice at this point. If that's a place where we can make an impact to, in the long run, protect our children and protect those who are particularly vulnerable, I believe strongly that we need to. At the same time, I support the comments made by Councilman Rosner in relationship to continuing to push on the state, but also continue to send the message about the importance of vaccination. We have to get people vaccinated. So those are my thoughts. Thank you for asking, Chair.
You're welcome. You're welcome. And I agree with the message of continuing to push back the state. I've been in 2 meetings now where the state's been pushing on us. So, but I know we're doing pretty darn well here in Washington County. Chair Kafori and I are back to syncing up with one another multiple times a day. She's meeting with her public health team later this afternoon, if there are additional policy things that we can do to affect change beyond this outdoor dining, then I will certainly share that with my colleagues and call a special meeting accordingly. And I will get in touch with you to make sure you know as well, Commissioner Treese. So let's
Thank
see.
you very much.
So to Commissioner Rogers, Commissioner Fye, and Commissioner Willie, any questions or comments that you have at this point? Go ahead, Commissioner Willie.
Thank you, Chair. So you referred to saving lives. The one statistic that we don't see so much anymore, unless I'm missing it, is the number of people that are dying. Is that staying consistent, I guess, with the earlier COVID cases? Is the dying rate about at the same rate as it was, or is it less?
Yes, thank you for that question. And let me clarify. I don't know what the morbidity rates are for this Delta variant. Rather, the alarm bell that has been rung by both OHA Director Pat Allen on August 6th, as well as the multiple state level experts on Monday, was that since hospitals are at this dire point of strain, they're not able to provide the level of care that COVID patients that are admitted have, as well as the other patients. That's the pain that I'm hearing. And because of that means more people are either having to have their care delayed. And there was a story of a former state rep, former county commissioner from Josephine County, whose husband had a heart attack on Monday and called for an ambulance, and they didn't have an ambulance to send because they're already stretched. And so she had to drive him to a hospital that he already served on the board of, and they still couldn't find him a bed. So his care has been delayed, and there's a cascading effect on that. So I am not a health expert. I'm just.
Would you like Dr. Rep to
Please, yes.
speak to that? She's
Thank
been
you.
following that a bit, so.
Thank you. So proportionally speaking, deaths have not increased with the Delta variant. So the number of people who are infected and the proportion of those that die have not changed that much over time. However, morbidity has become much worse. So as Chair Harrington was saying, the problem is, even if we're not having as many or the same amount of people die, I'm not sure that should be our end goal. But two, when your hospitals are full, as others have said, all these other people are going to die that aren't COVID related. Your car crashes, your strokes, the people who can't get in that need that life-saving care. So even though our COVID deaths aren't going to go up, and we saw this in the previous surge, I also supervised the medical examiner's office, our deaths in other areas went up significantly. And that is a direct result of the hospital system not being able to give the care needed. So no, deaths are proportionally the same, but the morbidity, the hospitalization, and the disease is worse.
Yeah, and I appreciate that, and I certainly don't want that to be our focus either. It was interesting to me that we just don't hear as much emphasis in the media about that. So second question is, I have heard that a very, very significant number of positive cases are from the unvaccinated. I thought I heard a 98% number a while back. I think the Oregonian had something 80 or 85% this last week. What is that number? Just an estimate, I guess, of that. And again, it's not important. It's just, to me, it's I need to know what those statistics look like.
Pam or
Sure.
Marie?
Sure.
Any of you jump in.
Absolutely. So the majority of cases now are unvaccinated. That is absolutely true. Depending on whether you're looking at Oregon State, Washington County, it's going to be anywhere between 80 and 99% of cases are unvaccinated. And I would also like to mention that people aren't necessarily having severe access problems to the vaccine right now. So the people who are not vaccinated right now, I am not sure that they would necessarily get vaccinated because we've been barking at them for 18 months to get vaccinated, and that hasn't been effective. So I wouldn't put too much hope in having unvaccinated people suddenly turn the curve around because of the Delta variant. But to answer your question, it's the majority of people who are unvaccinated that are cases, and we're starting to see that trend in hospitalizations as well.
Which is kind of mind-boggling to me. I mean, if you're not a scientific person, but you're a statistical person, or you look out on the landscape and you say, wow, 90-some% of the people that are testing positive are unvaccinated. I guess I should probably go get vaccinated, which is kind of the next question. I was thinking, so the reasons for not getting vaccinated and realizing that we have FDA approval coming on the horizon finally, do you think that is going to kind of clear the hurdles for some people to say, okay, it's now been approved, I can do this? Or a combination of it's now been approved and 90% of the people that are testing positive are unvaccinated. I mean, just kind of combining all that stuff together. Are we going to see maybe a little movement of that unvaccinated getting vaccinated?
I think Commissioner Willie, that we're hopeful that may move some people towards considering vaccination. But there is also a large group that has a lot of other fears, concerns, historical concerns with medication, mistrust of government, mistrust of the medical system. So we have a really big job in front of us to continue to just plug and plug and plug away at getting folks to feel more comfortable with vaccination. But hopefully that will nudge some people to get vaccinated. There's a lot of misinformation out there. Everything from people, I've sat on some calls and people think that there's a chip that's being implanted in them by the government. People think that it is going to affect their future reproductive history, that it's something, nefarious that we're injecting in people, that the whole thing is a farce. So there's just such a wide range of misinformation and fear out there that it's something we're just trying to just keep ticking away at. And really it takes your mommy, your auntie, your sister, your cousin, your preacher, your best friend to hold your hand and say, it's safe, it's effective, it's easy, it's cheap, let's go do this together. If you know anybody like that, offer to, hold their hand, take them down there, reassure them, talk to their doctor, talk to their minister, talk to anybody that they feel is trustworthy and safe, and that they can get all their questions answered.
Well, and so lastly, the proposal to restrict dining to outdoors. I cannot support that. And the reason why is because the restaurant industry has been one of the hardest hit industries, and they are holding on by their fingernails right now. I think the mask mandate can be strengthened if we have, I guess we give restaurants the opportunity to restrict who comes into their facility, vaccinated only. I don't know how that would, I mean, I realize that's a burden on them, but it's not nearly the burden on them than restricting them, because a pretty good number of our, especially our smaller restaurants, don't have the ability to go outside. And so, and realizing, you know, the next 4 weeks, maybe we're going to have enough good weather that we can still eat outdoors till a little bit later in the evening anyway. But I would like to do some more brainstorming on this. I am not supportive of restricting dining to outdoors. So that's all I've got. So thank you for that time.
Commissioner Rogers, I see you're unmuted.
Sure. Nice to see so many mayors. Many of you I've known a long time, many friends. And it's always nice to have partners in the room, because I think that this shouldn't be just that we're the health board of the county. It's all of you as well. You represent half the population. And so you need to know what's occurring. Just some random thoughts, things I shared with this board, not necessarily with the mayor groups, but with this board, is that this is a very divisive issue. And you're talking to her and looking at a guy who went out early and had my shots back in March, right up front. And so I take it seriously. But having said that, there's still a large percentage of the population, for the reasons that Marnie said, and others, do not get vaccinated and will not. And so our messaging needs to be a little better. We can scream, we can get excited, we can say lots of things, but that doesn't mean that they're going to trust it one bit. And the more that we use adjectives to like dire and the world's coming to an end, the less they trust us. And that's a shame, because I think that things need to be handled in such a way that everyone understands that for those of us of my age and a few others here, you know, we took polio shots, we took the mumps, we took the measles, and we'd take them again. I mean, I wouldn't even hesitate. We did that, but that's not true of this generation. So we've got to figure out some messaging that is not so threatening that people turn us off before they turn to us for advice. Jerry, I agree with you on the dining. That's been a serious issue. Federal government cannot continue to hand out dollars. If they are, the superinflation is going to occur. We're already having inflation. It's going to be worse. We talked several times at our board meeting today, for those of you who didn't tune in, about trouble finding workers, the economy, state of the economy. It's a difficult situation. When we talked last week about potentially having some kind of emergency, I was the only commissioner and who said, I support the action, I just don't support the timing. I want to have some kind of a glide pattern. For those of you who've either been in business or are in business, you know that it's not like a faucet. You don't turn it on and off. If you're a business who has supplies, let's talk about restaurants, you can't sit there and order lots of things and then shut down and then have to throw them in the garbage. You're not going to survive. You just can't do it. And the federal government cannot continue to hand out lots of loans and money. They won't be able to do it. And so these businesses are at a failure point. Talk to your chambers of commerce if you have any issues. There are lots of businesses who are disappearing. I mean, they just can't survive in this economy. So the messaging I would have personally, or what I would think we ought to be doing, is working closely with our schools to see what kind of messaging they need to send out to parents and how they want to handle that situation. We need to become maybe less animated and more concerned. But I don't know that we're going to convince that other 30% who really do not want to do what needs to be done. I try to encourage people all the time, but I don't have a lot of success. My board knows I just got back in about 1 a.m. this morning out of state and talking from people all around the country. And maybe Oregon's image is not what you all think it is. It's a little different. If you come from states like Texas or Florida or Arizona, in which they think that our few cases, they would, they think that's nothing compared to what they're having, and they're not shutting down, and their economies are robust and they're moving along. We all say one death's too many. I agree, one death is too many, but stop driving your cars. People die in car accidents. People stop, they die in a lot of things. So that doesn't excuse it. I'm not making excuses and saying we need to take lots of unreasonable risks, but what is that risk factor? Our experts today talk about projections. They talked about forecasting. And in the world of business that I'm in, that means that you're guessing, your best guesses. I think they're smart guesses, and I think you're smart people. And so I think it's fairly accurate. But for most people, when they hear those kinds of terms, they say, well, they're guessing at it. They don't know for sure. They don't make comparatives to other states. How do we compare? In our state, we think X number is the right number, and somewhere else they think it's a different number. And since we in Oregon think that maybe we're unique, well, we don't produce a lot. It comes from other states. We don't have a big economy like other states. So we like to talk about a region. I like to talk about a country. We're moving all around from all over, and we're trading and back and forth. And so I think we have to have a good understanding of how others feel about us and try to understand how we communicate that message out. So if the question is about masks, I have no problem. I wear them. That's not an issue. If it's about not giving a glide pattern to businesses in our communities, I have a problem with that. I think we need to tell them if we want to shut her down for a month, let's tell them. Let's give them a couple of weeks to, and then each of you who I'm looking at, and you're looking at me, you get to explain why they don't come back up. I mean, failure rate in small business, it's not the big businesses, it's the small ones. Failure rate's high, and it's going to be even higher. And we've got to understand how we do the best we can to keep those folks up and moving. Because there will be, after any war, and this is like a war of diseases, you have to have something to come back to. And what are we going to come back to? So my message is different than yours. I'm with you 100% and all that we need to do. I support the actions. I just think we need to temper our message, and we need to sit there and be collaborative with the mayors like we are being today, with our school superintendents, with our special service districts, and say, how do we together go through this and communicate the right messages? So that's my comments.
Well, I don't know if the state will be able to provide any further data about what can affect change and demonstrate that, other than the restricting restaurant dining to outdoor dining as we have today. But if that is learned and easily accessible from the state, we can consider that in our future Tuesdays moving forward. So, Commissioner Fye, your thoughts?
Thank you, Chair Harrington. I come into this discussion with a different lens. Being a public health professional myself, and before my current role, I was the contact tracing manager for countywide, specifically for Washington County. I've had staff who were tracing folks who were contact or positive, tested positive that we were tracing. And I've had my staff call the next day, and my staff tell me that their contact has died. And I've known some of my staff who lost their loved ones to COVID. So I come in with different lens of whatever possible we can do to mitigate the impact of COVID. I'm all for it. The more lives we can save, I'm in support. In this conversation, I will say that I'm a bit surprised that I thought we would require vaccinations, and starting with our employees, because I think, and I don't know if the question even came up, Marnie, I will pose it to you. Will mandating vaccines to start off with our employees and to the community organizations that we work with, requiring them to also vaccinate their staff, will that help mitigate this problem? Would that be helpful?
Commissioner Pai, thank you. I'll also let Tanya talk, but at this point, the more people that we can get vaccinated, that reduces community spread, and will reduce hospitalizations and deaths. Vaccination is our best tool. But mandating vaccines at the county level is extremely complex. It's definitely conversations that we have been exploring. But at this point, I think either Mr. Carr or Miss Angie might want to respond at the county level.
And to just clarify, because you said county level, I was talking about employees, starting with our employees and the organizations that receive funding.
Yes, sorry, that's what I mean, that they can respond for the organization. We are moving forward with the health care mandatory vaccination. So we have several classifications that fit into that. And we're putting our plan in place, and we will implement that mandate.
Thank you for your question, Commissioner Fye and Board of Commissioners. As Ms. Kyle has indicated, we have started that conversation internally about should the county move forward with mandatory vaccinations. I will state that several employees have already heard that we have just started this conversation as an option to explore, and several employees have reached out with their concerns, similar to what you all have talked about in this conversation, of those who are hesitant for a variety of reasons. And so we are not only looking at should vaccination requirement be an option, but then also how and what other tools can we use to help incentivize or provide additional resources to employees as an encouragement to become vaccinated. We do still continue to have our temp policy in place, which allows employees paid time to get a vaccine. So on work time to get vaccinated, to get that shot in their arm. I am also in active conversations with city managers also in the county, and we're sharing information because there's some employee groups that have expressed concern about losing employees if we require vaccines. And so is there opportunity to take a collaborative, as there's been conversation today, approach, a multi-jurisdictional approach? So we're sharing, because many times we're sharing the same workforce to deliver services to our communities. So active conversations are occurring.
Thank you, Tanya. I think I would have liked to see in addition to banning or limiting and dining to outdoors, I would have liked to see that county take that step or require testing. The other comments that we've heard from the mayors were also testing sites not being available. So what is Washington County going to do to ensure that testing sites are available moving forward?
So Commissioner Fye, thank you for that question as well. We are actively working with our federally qualified health centers, our health systems, and our public health teams to increase access to testing, but it's complex, sort of like if you remember at the beginning where when the health system is as busy as they are, to shift nurses and physicians and resources to testing, it's pretty complex, but we're definitely working with that. And we have strike teams that are specifically working with and preparing for school to start. And so they're working with the schools to try to do our best to ensure rapid testing is available for students as they re-enter school. So I don't know, Marie, or if anybody has anything else to add to that. No.
Yeah, I thanks, Marnie. I would add that as you highlighted, we're using all the same resources and they're being pulled in multiple directions as we are in this surge, this crisis with our health system. So we absolutely recognize the need for testing and the role that it plays in mitigating the spread. But at the same time, those same resources are being pulled toward vaccination, are being pulled toward healthcare. So we are in active discussions with all of our partners, just what can we bring to bear to balance out all of these different needs that are sometimes competing. So it's hard, and we absolutely recognize the need. Fortunately, there are at-home tests. While they don't get reported and transmitted to public health, they are another tool that people can access if they are needing a quick test. And those are also resources that are being explored with the state, whether we can expand availability of those in addition to the traditional lab-based tests.
I had one other question that was prompted, and Tom Carr said maybe a good legal one that you may not want to answer, but it's one for not only us as a board of the county, but maybe the mayors that might be interested as well. We all know we have workforce issues. We all have it, and then trying to get people to do things that they don't want to do and losing them hurts. But is there sound legal ground for that? If all of a sudden we start mandating things, either at the county level, we'll just pick on them, won't pick at the city, but and we say you don't get vaccinated, you can't have a job, or do we have exposure, and what kinds of exposure in your mind would we have for that kind of an action?
Well, Commissioner, I don't like to talk about potential legal liability in public. Because that can lead to things. There's some law, there's an Oregon law that makes it a little problematic. There's case law going back to the beginning of the 20th century that supports mandatory vaccination because this is not the first pandemic or public health issue where it's been an issue. It's certainly doable. There are some complications, and I'd be happy to provide you confidential legal advice on the issue of the potential risks.
So I won't push you, but it's fair to say that any of these mayors on the line or council presidents, if they have concern, they should consult with their own legal counsel. Yeah, before we take action, we should consult with you.
Yeah, the government attorneys have been in conversation about this and about the legal issues. So I'm sure all of their city attorneys are well aware of the issue.
So at this,
I have two more questions, Madam Chair.
Okay, great, sure.
Sorry. And I think this question, I think both questions might be for Marnie and Tanya, but the first one I'll go. Marnie, I remember, I don't know if you were with us, but I remember touring the Nike facility and the vaccinations that they were doing, and the National Guards were helping, anyways, here's where I'm going with this. Have we thought about asking FEMA or the National Guard to help, or other like non-hospitals like pharmacies to help with the testing?
Commissioner Fye, thank you. I do remember some of those, and FEMA was a fabulous resource for us in partnership with Virginia Garcia to get a few more vaccines in our arms to some of our more difficult to reach populations in July. So they were a nice resource. We have requested some resources from the state, and I don't know that it's specific for testing. I don't know if Marie has more current information. I don't believe it was really specific to testing, but it was resources to assist with contact tracing. And at this point, they didn't have any additional resources to send into the metro area. At least the last time I talked with Aaron Jolly, which has been a few days ago. So I don't know if anybody else has any more up-to-date information, but we are constantly watching for those kinds of resources and asking the state for assistance really regionally. So I don't know, Marie or Christina, if anybody has anything to add.
Yeah, thank you, Commissioner Fye, for the question. Those are good ideas. Where can we tap into resources that aren't necessarily being stretched by the large burden of patients in hospitals? I don't know that pharmacies have specifically been reached out to and asked. That's something that we can definitely take to our state partners as they liaise with pharmacies around vaccines. We can ask about the testing option with respect to getting some federal or state resources or the National Guard. That question has been posed with respect to testing. Those resources can't always be directly involved in patient care. So we're looking at how else can they support the whole system. And testing could be an option. And we've sent that question up. We haven't heard yet. I feel like I've been pretty cautionary on this meeting, but as we know, limited resources, a lot of demands statewide as well as federally. So I can't say I'm completely optimistic that we would get everything that we ask for, but hopefully we can get some additional support.
Thank you. And then my last will be a comment to say, while I support the restriction that the chair put forward, I want Washington County to consider how we can support the businesses and what support we can offer them to mitigate the future impacts this would have 4 weeks. Because I know some of the, especially the restaurants, we're gearing up and have geared up to open it up completely, and we're really excited. And I want us to see how we can really redirect some ARPA money to mitigate some of this, impact financially or otherwise that's coming to this industry. So thank you. I yield it back to you, Chair.
Thank you. And thank you, commissioners, for sharing your thoughts. I think, as you can see here, Commissioner Fye has quite a strong holistic view in looking at things comprehensively. So what you've been hearing from me today for this meeting is really focused on the very short-term question of how do we help with the situation that we're in right now, this surge and threat to the healthcare system. I've heard that she is willing to support an restriction on outdoor dining if we're able to put some mitigation in place for those businesses that don't have the support of outdoor dining or the level of capacity outdoors that they do with combined outdoor and indoor. I heard that Commissioner Treese does not prefer to put such a measure in place, and for the reasons that they stated, Commissioner Rogers and Commissioner Willie are not in support of that. That is just for the proposal that
Chair Harrington?
Yes, ma'am.
Could you please would you restate what you said about what I said? Because I am supporting the ban on indoor dining. I would support that. I agree with Commissioner Fye that we need to mitigate the impact on the restaurants. And I also want to point out that we're not closing restaurants. We're just moving the process to outdoor dining, continuing with takeout as we did previously. So I wanted to make sure that you heard me correctly on that.
Sorry, I didn't write it all down properly. So thank you for clarifying your position on that. So that leaves 3 of us of the 5 of us who were willing to move forward with a proposal of restricting dining to outdoor only. So we'll need to take that and turn to Ms. Angie and Mr. Carr to put together such, hang on a second, such legislation for consideration by the board. I realize, Commissioner Treese, that you're on vacation. So I'll reach out to you and hear if you would be available for a special meeting for such a thing, or if we just wait until next Tuesday. Commissioner Willie.
Chair Harrington, I would work hard to make sure that I'm available for a special meeting. So just keep that in mind.
Yep. Thank you, Commissioner Treese. Commissioner Willie.
Well, and just to make sure I clarify my position, I think restricting dining to outdoors is kind of putting all of our eggs in one basket. We're saying that's the solution to turn the tide here, or at least stem the increase. And I don't agree with that. I think enforcing our masking policy and putting together testing opportunities. My 7-year-old grandson went to sports camps all summer long, and he didn't get to walk on the field without being tested with the simple test of the temperature test. And I don't know how accurate that is, but certainly that's one of them. It certainly worked for him all summer. Again, providing some stronger masking mandates or recommendations, or helping our businesses that are most strongly impacted indoors on the masking side of things. I think that's going to have a significantly higher success rate than taking the small businesses out of the ability to provide anything but takeout food because they don't have an outdoor space. I just think we're being very restrictive in our thought process here. So I'm asking to hit the pause button and say, let's have conversation about what are the options that we have available. And let's look at the whole gamut. That's what I'm focused on, not just outdoor dining.
So I'll respond to that and then call on Ms. Kyle. So our team's already moving forward with the testing opportunity. They don't need any further permission from us to move forward with that. They have all the administrative flexibility to move forward with that. On enforcing masking, you're correct that I did not, and I'm just one of 5 to bring proposals forward. I did not bring forward a proposal today to enforce masking because of with the homework that I've done. I know that if people just follow through on the state requirement of masking, it will make a difference. But using our valued resources to impose fines, and businesses have the flexibility they have today to enforce masks. So we have a statewide mask requirement in place. So I just didn't make that proposal. So if you'd like to, that's perfectly fine. So go ahead, Ms. Kyle.
Thank you, Chair Harrington. I think I decided to let you all finish your conversation, but I was planning. It would be helpful to have clarity around this board's support or comfort with us enforcing the mask mandate, including up to and including writing citations and fines. And I don't want to cut off any of the other conversation, but that clarity would be helpful.
Well, let me clarify. First of all, writing tickets and issuing fines is not what I was talking about. We seem to be focused on punishing the businesses rather than the perpetrators. And we've got to be able to provide opportunity to help the businesses support the mandate. So I don't know what that looks like, but certainly having conversations with our restaurant industry, with our businesses that are directly impacted with this, seems to me to be the first step of this conversation. And it is not fast tracking this decision to having a special meeting before next Tuesday. It is, I don't even believe it's having the meeting next Tuesday, but at least that gives us 7 days to have some conversations. But we're trying to use a machete, and the victim is the small businesses. And that's what my opposition is. I think we can come up with a better solution, but it's going to take us having conversation with a lot more people that are on this Zoom call. That's what my position is.
And you're welcome to have any and all of those conversations. I'll be following up with Ms. Angie and Mr. Carr on what it will take to put together a piece of legislation, and from that make a proposal with regard to having a special meeting or waiting until next Tuesday. And I already understand you're going to be opposing such a proposal. Yes, Commissioner Trees, go ahead.
That is a terrible example of team play, what you just did right there. I'm sorry, I got to call it for what it is. We got beat up last night because we didn't communicate with our business community in a sector of Hillsborough. We're going to get beat up on this one too, rightfully so. You at least need to be able to say, okay, I'm willing to sit down and talk about it, rather than, well, it was my proposal and I've got 3 votes, so we're going to move ahead. That's not team play.
We're going to be talking about it further when we have that meeting.
You got, yeah, when we have the meeting to decide. When we have the meeting to decide, and you're going to bring it up, we're going to vote on it. It'll go down 3-2, and that'll be a victory. That's team play.
Commissioner Treese?
I just would like to register my concern about the how quickly the Delta variant is making an impact on our population. And I want to register the fact that I think we should be using all tools that we possibly can to protect, especially our youth. So that's my statement regarding my interest in having a special meeting. It's so that we can act as quickly as possible. It's not about eliminating different options. It's about acting as quickly to deal with the progressiveness of this situation.
I agree with you.
I have one other question too, and this is probably to Marnie. I think people see where the direction is going. We all have our positions, but in regard to enforcement, obviously the sheriff's office doesn't have enough folks to do that, and so we'll be relying on our city partners, I presume. And how will that work? Because what I've heard from some of the cities and folks I'm looking at on this is they don't have the capacity to do that. So I'm just trying to understand the mechanism. Should that be proposed? How would it be done? Who are you expecting to do it? Will our court system have enough capacity to deal with it? If it's cited in cities, will they be going to their courts there, their municipal courts? Are we citing them into the district courts? Have you thought about all this and how it might work?
So Commissioner Rogers, thank you for the question. A couple things. First, I want to reassure you that we are going to take an approach similar to what we did last March for the last 18 months. So the most important approach is that we support and work with our businesses. We provide information, we provide education. We were making visits, we were having weekly calls. We were doing everything we could to support the local businesses and help them and assist them as they implemented all of the different governor's orders, in this case, the mask requirement. So our approach is to support businesses. That's where we start, educating, answering questions, offering solutions. You all remember we got really creative last time in our ability to support the businesses. So that's where we start. The second thing is that I would anticipate, like our other enforcement activities, that this would be complaint driven. And so we only respond when we get complaints about a business, because we're not out patrolling, we're not out searching for non-compliance. So it's really willful ignoring of the rules. So after we've gone through all of the steps of trying to help people make sure they understand the guidance and help them to follow it, if they're still, I mean, we have businesses like we did before, they're advertising, we are not going to enforce this, we don't believe in it, and they're actually advertising people should come in and not wear a mask. So it's those kinds of businesses that we really need to focus on. We would need, if you were supportive of us moving to those higher levels of enforcement, we would definitely need to have conversations with our sheriff's office, because they need to do a different delegation to our code enforcement officers within environmental health. And my understanding, and this could be for a different executive session maybe, or just a different session, but my understanding is because it's a public health mandate, that it is enforceable across the county within cities. And that's the way that we that's the way we worked before, when there were mandates. If the restaurant or the business was within a city, we still would work with that business, and we would still send our letters. And ultimately, oftentimes it's also promoted to OSHA, because sometimes they have more teeth than the local jurisdiction.
Marty, just one follow-up, real quick comment. If that's the direction we go, I would hope that we re-involve our mayors and their cities, because obviously the blowback will be on them. It's just as much as us. I would like to have them at least understand what's going on, participate in that discussion, and have their input. And so I hope that, you know, whatever get crafted, that they get involved, or asked to be involved anyway.
Yeah.
Thank you.
So to that, Ms. Kyle, I made two assumptions. One is, since the state has already instituted the mask requirements, and your team already has the experience of providing information to the businesses, I made the assumption that you have already what you need, and that we didn't need to take any action. The second assumption that I made is that if you wanted to make a recommendation, such as you verbalized today, that you would have made that clearly in today's presentation of public health recommendations. And that wasn't done either, which is why I haven't spent any time on it today.
Understood. And we are definitely implementing the education outreach and for the similar steps to what we did last spring and for the past year. It was just coming up, and so I was just trying to get some clarity around whether the board wanted us to move further into enforcement than we had done last spring.
So commissioners, there's a new question on the table. Go ahead, Ms. Angie.
So Chair Harrington, from a staff perspective, I would suggest that the board take this up. Any enforcement measure on business is an anomaly, and Marnie did walk through the process. But these are businesses, as Marnie stated, that are outright operating against the mandate. So it is the exception, and we do focus on education. I do want to lift up, we get various questions from especially small businesses of how do you contact or approach a customer? And our staff are working with businesses on that education and outreach. But we do have some cases of outright just not wanting to uphold the mandate.
So is it fair for us to ask you all to either highlight here today what the questions are that you have for us, and if we need to come back to this as a board, that you have the time to do that? It will give us the opportunity to put notice to the mayors so they can walk through with us. Or do you have an urgent need such as I thought I heard Marnie say about complaint driven higher levels of enforcement with the sheriff, so they need to do a different level of delegation to environmental health. Are we better served to lay that out at a future meeting versus today's meeting?
Chair Harrington, I would agree with that, and we would create a process outline similar to, I'll relate it to code enforcement outline that we can bring back to the board. So the board can weigh in on that process and provide any feedback. And it would be available to cities at that time as well.
Okay. So I think we have the summary that we do today. What we don't have is knowing if we're going to have the opportunity of doing this between now and next Tuesday in a special meeting, or just come back to these questions, both on outdoor dining restriction as well as the needs for masking. In addition, as I mentioned, Chair Kafori is meeting with her public health team, and their board are having conversations. Part of what we heard as feedback from our collection of mayors is let's do this as a region. And while I think there is a lower likelihood of the Clackamas County Board moving forward with these ideas, I think it may be meaningful for us to convene, at least Chair Kafori and I can convene and compare notes so that we could have even a stronger coordinated set of actions next week. So those are some outstanding questions. And sorry, Marie, I'm still practicing your full last name. I did see you had your hand up. So I was just trying to summarize where I think we're at today. It's a little bit of an unknown space, or not 100% certain. So, oh, and sorry, I keep meaning to, if I'm going to hold one more second here. I just wanted to make sure, as I said earlier, I was dealing with the urgency of the now as opposed to the longer term. And yeah, schools are going to convene in a couple more weeks, and they have events coming up. So as I mentioned, if one of their requests is, if we're ever going to have to look at capacity limits, to please first think about attending only if vaccinated versus ending all events or restricting capacity. Another thing that they're interested in is making sure in the short term that there's clarity on what the metric is for safe in-person activities. And then longer term, assuming that there will be more variants, right? And therefore assuming that there may be masking rules, wanting to make sure that we have clarity on those rules and what enforcement is all about. I mentioned concern about ensuring that particularly that first day and first week of school is successful. And there may need to be some task forcing done amongst our public safety committee. So if anything untoward happens, and they have no reason to think it will here, but it has occurred elsewhere in our country, that they know who to call on to ensure that kids and parents who are dropping them off are safe. That's all. With regard to that, the requirement for schools convening with full masking. So that's the full summary on the schools. Marie, back to you.
Oh, thank you, Chair Harrington. I just wanted to reassure the commissioners and the mayors that regional conversations are happening with the LPHA administrators and health officers. We actually have a couple of meetings this evening. And so as quickly as COVID is changing, so are the recommendations that we'll be putting forward. And we're happy to share the information as we have more. So thank you.
Thank you. So commissioners, I can't tell you today if our next meeting will just be next Tuesday with some additional COVID things here as we've talked about, or in a special meeting. Although, as I summarize in my head, coming back to the enforcement will, I think, definitely be on our plate for next week as well. So we'll go from there. So any further discussion or comments from anyone, any board members or mayors that you would like to contribute at this time?
Mayor, this is Pam Treese.
Yep.
I would like, the mayors all thanked you and the commission for opening this meeting. I would like to thank all the mayors for attending, because we are all in this together, and I truly appreciate the perspectives from the mayors and the councils that they represent. So thank you for participating today.
Yes, definitely. Thank you so much. And thank you for giving us over 2 hours of your time today. I really appreciate it. And thank you to also our various state legislators who have hung in there on this call. In addition to Senator Chuck Riley, Representatives Janine Solman, Courtney Neron, Dacia Graber, really appreciate your being on this journey with us. So without further ado, unless anybody has anything for the good of the order, I will adjourn today's work session. Thank you, Commissioner Treese, for dialing in. Stay safe, everybody.
Thank you. And thanks to the reps as well.